Hello, everyone. Thank you for joining together for the second Global COVID-19 Summit. And a special thank you to the leaders of Belize, Germany, Indonesia, Senegal for co-hosting this summit with the United States. Today, we're again uniting countries around the world with leaders from the private sector, civil society, and the philanthropic community to carry forward the vital work on fighting COVID-19 everywhere, not just at home, everywhere. When we met last in September, we were focused on critical and urgent challenges. And I'm incredibly proud of the work that we've done together over the last several months and the commitments that we have made to vaccinate the world. For our part, the United States has provided more than $19 billion to help countries fight COVID-19 all around the world. We provided life-saving medicines, oxygen, tests, equipment, supplies, and partner with countries to improve their capacity to manufacture vaccines as well. We've delivered more than 500 million vaccines to 115 different countries. And we're going to continue to work with COVAX to deliver another 500 million doses, all part of the pledge we made to donate 1 billion doses of vaccine to the most vulnerable in the world. All this is completely free. No strings attached. But there's still so much left to do. This pandemic isn't over. Today, we mark a tragic milestone here in the United States. 1 million COVID deaths. 1 million empty chairs around the family dinner table. Each irreplaceable losses. Each leaving behind a family, a community, forever changed because of this pandemic. My heart goes out to all of those who are struggling, asking themselves, how do I go on without him? How do I go on without her? What will we do without him? It's grief shared by people across all of our nations. Around the world, many more millions have died. Millions of children have been orphaned, and with thousands still dying every day, now is the time for us to act, all of us together. We all must do more. We must honor those we have lost by doing everything we can to prevent as many deaths as possible. Today, we're at a new stage in fighting this pandemic, facing an evolving set of challenges. We have to double down on our efforts to get shots in people's arms, country by country, community by community. Ensure we have reliable and predictable supplies of vaccines and boosters for everyone, everywhere. Expand access globally to tests and treatments. And we have to prevent complacency. This summit is an opportunity to renew our efforts, to keep our foot on the gas when it comes to getting this pandemic under control and preventing future health crises. Collectively, we're making significant new commitments to help keep up the fight against COVID-19 in 2022, protect the most vulnerable populations, and prepare for the next health crisis because there will be others. And the United States is going to continue to do our part. Today, I'm announcing the United States will share critical COVID-19 technologies through the World Health Organization COVID-19 Technology Access Pool. We're making available health technologies that are owned by the United States government, including stabilized spike protein that is used in many COVID-19 vaccines. We're standing up a new pilot program, working with the Global Fund to expand access to rapid testing and antiviral treatments for people in harder to reach areas. And we're increasing our support for a new pandemic preparedness and global health security fund that will be established at the World Bank this summer with $450 million in seed funding. I particularly want to commend Indonesia and Italy for their leadership in helping make this fund a reality. And I'm encouraging other leaders to join me in upping their commitments. We're going to face together global health crises. This is not the last one we've had. It's not a question of if, it's a question of when. So we have to invest now. We have to secure political commitments now. We have to start working to prevent the next variant and the next pandemic now. And that's going to require all of us to do more. I encourage every leader to ask yourself, what more can I do? How can we work more closely together to help more people? How can we save more lives? That's why I continue to call on Congress here at home to take the urgent action to provide emergency COVID-19 funding that is vital to protect Americans, to make sure that we maintain our supplies of COVID-19 tests, treatments, and vaccines, including next generation vaccines that are being developed. The request also includes $5 billion to keep up our global partnership in the fight against COVID-19 and sustain our efforts to get shots in people's arms all around the world, expand access to treatment, and save lives everywhere. We can do this. We can control COVID-19. We can start to build a better, healthier, and more secure future today if we all do our part and if we step up together. So thank you for responding to this fight, and most especially, thank you for all the doctors, nurses, and community health workers, and scientists, and aid workers, and anyone and everyone on the front lines fighting this pandemic, saving lives every single day. We owe you. Thank you. God bless you all.
Thank you to President Biden, Vice President Harris, our distinguished co-hosts, partners, world leaders, and everyone tuning in today. Together, our efforts will help end this pandemic, which has caused so much pain and disruption. My name is Linda Thomas Greenfield, and I have the honor of representing the United States at the United Nations. When we convened the last summit, I said that only a truly global response can meet this moment. That was just over 7 months ago. And in that time, our global efforts have saved countless lives. The United States, in partnership with COVAX and others, hit a critical milestone, donating over 500 million vaccine doses to over 115 countries. We've provided more than $19 billion in COVID assistance, ranging from health, humanitarian, economic, and development support. But we know supplying COVID-19 vaccine isn't enough. We also need to accelerate vaccine uptake and ensure vaccines make it into arms quickly and equitably. That means tackling difficult cold chain supply issues, addressing vaccine hesitancy, and expanding distribution support. And that's why we launched the Global Vax program to further ramp up COVID-19 vaccinations around the world, providing resources to more than 70 countries and surging support to 11 developing countries in sub-Saharan Africa to reduce vaccination barriers. I've had the opportunity to travel around the world, from Niger to Thailand, and I've watched the vaccines we've donated actually go into arms. I've seen how our assistance has protected vulnerable populations and frontline workers from sickness and death. But our work isn't done. In total, we'll ship out 1.2 billion doses across the globe with no strings attached. We're doing this because no country can end COVID alone, and we're committed to increasing vaccination rates for every country. Today is about keeping up the momentum and saving lives. As the disease continues to evolve and new strains emerge, our strategy is to defeat the pandemic. Our strategy to defeat the pandemic must also evolve. Let's marshal our collective knowledge and resources to distribute more vaccines, expand equitable access to testing and treatment, and support healthcare workers. At the same time, let's also keep our eye to the future so we are better prepared to prevent and respond to the next pandemic. The investments we make today to strengthen our health systems, protect those in need, and make access to vital resources more equitable will pay dividends for years to come. And that's why we're focused on advancing global health at the United Nations, where I'm working with coalitions on antimicrobial resistance, global health, security, and universal health coverage. We have to come together bilaterally and multilaterally to ensure our global health system is as strong and prepared as it can be. And now I'm pleased to introduce President Macky Sall, African Union Chair and one of the co-hosts of today's summit. Senegal's COVID-19 response and recovery efforts through a go early, go hard, and keep it simple approach is an example to all of us. Mr. President, over to you.
Thank you, dear Linda.
Thank you very much, dear colleagues, ladies and gentlemen. I would like to acknowledge and thank President Joe Biden for his invitation to this second COVID-19 pandemic summit. I salute our fellow co-organizers, President Widodo, Chancellor Scholz, and Prime Minister Briseno. I also salute the presence of the heads of state and government, and in spite of the improving situation, the holding of this summit shows that we must not let our guard down and that we must be prepared for other potential health challenges. In Africa, we have been able to remain resilient in the face of COVID-19, with relatively few positive cases and deaths compared to the rest of the world, whereas the worst was feared. Our countries have adopted response strategies, each within their means. We have also coordinated our response efforts at the continental level under the leadership of President Cyril Ramaphosa of South Africa, with the support of the African Union Commission and Africa CDC. I thank the partners for the donations of vaccines through the COVAX, AVAT, and bilateral cooperative initiatives. All of these countries need to be thanked. I would like to draw the attention of our summit to 4 priorities for Africa. 1, universal access to vaccines and improving immunization rates. Because today, the populations quasi refuse to be vaccinated. We have to come up with new strategies to have the vaccines be accepted. Secondly, accelerating the process of local vaccine production. Some African countries are already producing the COVID vaccine. Others, including Senegal, are preparing to do so very soon. I recall that last February, the 6th Europe-Africa Summit launched an initiative for the production of messenger RNA vaccines in 6 African countries: South Africa, Egypt, Kenya, Nigeria, Senegal, and Tunisia. We call for greater diligence in the implementation of this initiative. Third priority, Africa wants locally produced vaccines to access marketing and distribution platforms such as Gavi. This is what will make local vaccine production sustainable. We held a meeting on this subject on May 10, 2 days ago, in order to advocate the purchase of vaccines produced on the continent. Number 4, we are advocating the establishment of a more inclusive new world order of public health, more inclusive for better handling of cross-border health issues. Finally, In terms of national commitments, I would like to point out that the Pasteur Institute in Dakar is building a new biotechnology platform with a component for the production of vaccines against COVID-19, as well as other diseases. In support of this project, the state of Senegal has made a 3.3 hectare site available to the Institute, and we have mobilized a funding of $91 million, including a loan from the EIB of $79 million. This project also is benefiting for $14 million in grants for the World Bank, from DFC, also the BEI and the EU and the French Agency for Development. The total cost of the project is of $220 million. And to conclude, I would like to applaud the American initiative to organize this summit. I would like to thank you, the director of the WHO, for his participation in this fight. I would like to salute all our friends, such as Mr. Trudeau, President Sanchez, who are along our sides. Thank you very much.
Thank you, Mr. President. I'm pleased to give an opportunity for our second co-host and G7 President, Chancellor Olaf Scholz, to discuss Germany's COVID-19 response efforts, as well as how they fit into the overall global response. Mr. Chancellor, thank you for your leadership, and you have the floor.
President Biden, Vice President Harris, co-hosts and colleagues, ladies and gentlemen. A well-known quote says that perception is reality, but the COVID-19 pandemic is proving this wrong. Our perception might be that COVID is over. Russia's war of aggression against Ukraine has overtaken the pandemic in the headlines. And after more than 2 long years, people are simply tired of hearing and reading about COVID. But the dire reality is the pandemic is not over. More than 6.2 million people around the world have died from COVID-19. That's about the entire population of Singapore or Denmark. And every day more people are dying. Current outbreaks and new variants of concern show the risk of prolonging the pandemic even further. For many countries, especially in the global south, this is a disaster, because the pandemic comes on top of other serious challenges such as food shortages, rising energy prices, and the effects of climate change. As a result, global debt and inflation are increasing rapidly. So what is needed? The short answer is money. The ACT accelerator must remain our top priority. As the holder of the G7 presidency, Germany wants to lead by example. For 2022, we are contributing another $1.5 billion US, increasing our support since 2020 to $3.5 billion. In addition, we have already donated 145 million vaccine doses. Recently, we hosted the COVAX financing conference together with Gavi. This raised a total of $4.8 billion US. But there is still significant funding gap, which we must close together. This is why we are here today. Secondly, we must recognize that reality has changed. In 2021, we were short of vaccines. In 2022, we have the vaccines, but we are lagging behind on vaccinations. We therefore need to strengthen absorption capacities, especially in countries with weak healthcare systems. As part of our last mile initiative, Germany will provide €850 million to our partner countries, especially in Africa and the Middle East. Thirdly, we need to look beyond the current crisis. In order to be better prepared in the future, we must strengthen the World Health Organization and its coordinating role. The good news is that the WHO Working Group on Sustainable Financing has just reached an agreement to put the WHO program budget on a more solid financial footing. This will enable the organization to carry out its important job more effectively. Fourthly, we need more local production of vaccines against COVID and in the longer term against other diseases such as malaria or Ebola. Germany is currently investing more than 500 million euro to expand local vaccine and medical manufacturing in Africa. Our pharmaceutical industry has stepped up its commitments as well. But we also rely on your continued support via Gavi, the Global Fund and other multilateral instruments. Finally, we need ongoing support to build resilient healthcare systems. This is where President Biden's initiative comes in. We support your proposal, dear Joe, to set up a new fund for pandemic preparedness at the World Bank, operating in close coordination and cooperation with the WHO. And I'm happy to announce today that, subject to parliamentary approval, Germany will contribute an initial 50 million euro. We look forward to working with you on setting up the fund and turning it into a global success story. So thank you all for joining us today. Together we can make this summit a success. By taking action, we can change reality.
Thank you, Chancellor. Thank you for that strong commitment. Now I'm delighted to hand the floor over to another co-host, an effective leader who has played a critical role for the global COVID-19 response and recovery efforts, and particularly in his current role as G20 chair, Indonesia's President Joko Widodo. Mr. President, you have the floor.
President Biden, distinguished world leaders. The COVID-19 pandemic teaches us a very important lesson. Global health, resilience, and preparedness for pandemics is not strong enough. As a result, the price we paid was very high. Millions lost their lives, and the global economy faced recession. Therefore, we must work together to mitigate the pandemic and build a stronger global health architecture and preparedness. To mitigate the pandemic, vaccinations must be expedited to cover 70% of each country's population. The current momentum of reduced cases must be utilized to deliver the final blow against COVID-19. Vaccines must quickly become vaccinations. Our collaboration must bridge the challenges of vaccination from financing, logistics, and human resources. Meanwhile, to build a stronger global health architecture and preparedness, at least three things are needed. First, inclusive access to health. All peoples, without exception, must have access to essential health services. Health infrastructure must be adequate and equipped for pandemics. At the global level, all countries, big or small, rich or poor, must have equal access to health solutions. Second, adequate access to financing. Not all countries have the resources to improve their health infrastructure. We need a new health financing mechanism that involves donor countries and multilateral development banks. Support for health financing must be viewed as an investment as well as collective responsibility to prevent pandemics. Third, empowerment. Collective capacity must be built and international cooperation becomes key. Research cooperation, transfer of technology, and access to raw materials must be strengthened. There should be no monopoly in the health industry supply chains. Diversification of production centers of medicine, vaccines, diagnostic and therapeutic equipment must be implemented. In its capacity, Indonesia stands ready to become a production hub for vaccine production and distribution in the region. Excellencies, Indonesia's G20 presidency brings great attention to inclusive health cooperation. For this, the role and participation of all countries are required. WHO and multilateralism must be strengthened. No one should be left behind in our effort to build a stronger global health architecture and preparedness. Recover together, recover stronger. Thank you.
Thank you, Mr. President. Now I will turn to Prime Minister Johnny Briseno, who can speak about COVID-19 response and recovery efforts in the Caribbean, especially as CARICOM chair. We're grateful for his partnership and leadership. Mr. Prime Minister, you have the floor.
Excellencies, greetings. Thank you, President Biden, for convening this second COVID-19 summit. I also welcome the other co-hosts and extend thanks to everyone for your commitment to lead on the global response to the pandemic. Thus far, significant advancements have been made in areas such as surveillance, testing, rapid development of vaccines, and antiviral treatments. As a result of this, many countries are witnessing declines in serious death cases and deaths. But the pandemic is not over. Global testing rates have been declining. Presently, low and low middle income countries account for only 20% of testing globally, even though we account for over half of the global population. Recent figures show a 15.4% increase in new infections in the Caribbean. Deaths increased for the third consecutive week by 39.6% as compared to the previous week. According to the WHO, reported cases in Africa are also rising. Many countries, including several in CARICOM, are far below the targeted 70% of the population vaccinated and are unlikely to get there by September. Low testing, lack of capacity in sequencing, lack of access to vaccines, and high cost of treatments slow the pace of ending the acute phase of the pandemic and create a global environment conducive to virus mutation. As well, it undermines the good progress that has been made. Presently, Latin America and the Caribbean has been the hardest hit region in the world, accounting 20% of infections and 30% of deaths from the virus. This while our region accounts for only 8% of the global population. As it relates to our economies, in 2020, Caribbean economies contracted on average by 6% above the 4.4 contraction worldwide and grew on average by only 1% last year. We say then that now is the time to double on what we know works: testing, vaccination, treatments, and appropriate public health measures. We must accelerate efforts to inoculate 70% of the global population, especially those with comorbidities. CARICOM is committed to this global goal. To get there, however, will require more efforts to improve accessibility to vaccines, including pediatric vaccines. Likewise, financing and political commitment are required to overcome operational and logistical impediments in difficult to reach areas and to access vaccine hesitancy. In Belize, 59% of our population are fully vaccinated. We hope to soon access pediatric vaccines to further enhance the number of persons fully vaccinated. Excellencies, CARICOM leaders are committed to redouble communication messages and accelerate public education efforts to address this misinformation, myths, and other drivers and enablers of vaccine hesitancy at all levels. CARICOM heads have further directed regional institutions to examine the social and financial viability to develop vaccine manufacturing capacity for the region. Access to vaccine in a timely manner has been a critical weakness of the global response. At the same time, we must maintain access to testing and to sequencing, which are essential to detecting, tracking, and responding to new COVID variants. Belize, with the support of international partners like the US government and the World Bank, received geometric sequencing equipment to detect COVID-19 variants, as well as the related training for our laboratory technicians. This is helping us to develop our capacity to analyze virus samples. We know that the next battleground in our fight against the pandemic will be in treatment. Therefore, we must do all possible to ensure that antiviral medications are available to everyone as soon as possible. Access to treatment in our present is our moral test, and we must not fail. So let us strengthen the global health architecture and ensure it is sustainably financed. As for us in Belize, we are doing our part. We have increased our budget for health, expanded our national health insurance to cover more Belizeans, and strengthened our awareness campaign. Excellencies, important lessons have already been learned from the pandemic. Some painful, too many tragic. But we can also celebrate the victories, like our power to collaboration and cooperation, like the depth of human ingenuity and brilliance we have seen in so many of our people, like the compassion, empathy, and solidarity spread across oceans and seas, like the unprecedented public-private partnerships we have fostered, including today's summit, which stands on the foundation and is imbued with that spirit. This is how we overcome this pandemic, working together as one global family. Once again, to President Biden, to the heads of state of Indonesia, Germany, and Senegal, leading the summit, and to all gathered in this viral space, I thank you.
Thank you, Prime Minister. In this work of strengthening health systems and global health security, I'm grateful to have joined forces with Vice President Harris, who has charged forward with the urgent work of preventing, detecting, and responding to future public health threats. And now I have the privilege of introducing her. Madam Vice President, the floor is yours.
Thank you. Thank you, Madam Ambassador. And thank you, all of you, for co-hosting this very important convening. Prime Minister Briseno, the President, of course, Sall of Senegal, and Chancellor Schultz, and President Widodo. Thank you all, and I also see my friend Prime Minister Trudeau and President Sanchez. I want to thank you as well, and everyone who is here with us today. Today marks a solemn milestone for us in the United States, the loss of 1 million American lives due to COVID-19. 1 million lives. Today and every day, we remember them, of course, and we honor them. And I send my prayers to their loved ones, and I recognize all the pain that has been endured by them and those who have lost loved ones around the world. I believe we owe it to their memories and to the millions of other lives lost around the world to renew our fight against this deadly virus. Which brings me to why, of course, we are all gathered here today. Over the last 2 years, as we all know, COVID has had a devastating impact on people around the globe. Economic shocks, a massive disruption to so many parts of our daily lives. And of course, yes, we have made remarkable progress. Yet without continued action, lives and livelihoods will continue to be at risk. This is why our administration is hard at work in Washington, D.C., doing everything we can. As you heard just a moment ago from President Joe Biden, there are a number of ways in which we have and will continue to take action. We have called upon the United States Congress for $22.5 billion in additional emergency funding to battle COVID. $5 billion of that would be dedicated to continue our leadership in helping to save lives around the world. We will continue to advocate for these life-saving resources as part of our global commitment. All of you in this headliners session have also taken very important steps and have made key commitments, and we thank you. In our collective words and actions, we are all making clear complacency is not an option. As we gather today, our goals are twofold. One, we must continue to respond to the threat, and two, we must prepare for the future. As long as the COVID virus is present in one country, it impacts all of us. This pandemic, of course, knows no borders, and we must continue to work together to find solutions. We still, as has been said, we still need to make vaccines, tests, and new treatments accessible to all, and especially to those who are highest at risk, the elderly, the immunocompromised, and healthcare workers. I am also aware that countries throughout the world need more training for doctors and nurses and community health workers, and more technical assistance, including freezers, to help get shots in arms. We look forward to partnering with all of you on this. We must also keep an eye to the future. We have learned key lessons in the past 2 years. Lessons about the importance of early detection and surveillance, the need to leverage the private sector and nonprofits to scale production of medicines and tests and vaccines, the transformative power of investments in health systems and health workers, the complicated mechanics of donating and distributing hundreds of millions of vaccines around the world, and the life-saving benefits of a global health security fund. Last year at this very summit, we discussed this particular lesson, and you'll recall I urged us to work together to develop a new financing system and mechanism. Thanks to President Widodo and Prime Minister Draghi, through the G20, we have consensus to establish this fund. And I know we all know and have said it will help us on very critical issues like early detection and warning systems and investments in rapid recovery and response. And this is just the beginning. The way I see it is this. As we think about moving forward, I believe we can also come together, in addition to everything we have discussed, come together to shape new international norms on these issues. Together, we can establish common understandings that guide our collective action, that all countries, regardless of GDP, should have access to life-saving vaccines, tests, and therapeutics, that nations should be transparent and share information early and often, that leaders should prioritize the most vulnerable and the overlooked, and that we must recognize and address inequities in our systems. The future, of course, will present other global health crises, but they don't have to become catastrophes if we do this work together. Now is the time, we know, for bold thinking and concrete action. And I look forward to this discussion and continuing discussions and the work we will do together to shape the future of global health and health security around the world. Thank you all.
Thank you, Madam Vice President. Our next speaker has been at the forefront of COVID-19 efforts in his role as Director General of the WHO. We're facing a world in which we need to be able to manage COVID-19 for the longer term. I'd like to introduce Dr. Tedros Ghebreyesus to discuss his views on WHO's efforts to translate vaccines into vaccinations, expand access to tests and treatments, and build and finance health security capacity at the country and regional level for the next pandemic threat. Dr. Tedros.
Thank you. Thank you very much, Ambassador Greenfield, President Biden, Vice President Harris, Excellencies, Heads of State, Heads of Government, dear colleagues and friends. First of all, I would like to thank the US, Belize, Germany, Indonesia, and Senegal leaders for bringing us all together today. The last time we met in September last year, little did we know that the Omicron wave was just around the corner. So although reported cases and deaths are now decreasing globally, it's misguided to think this pandemic is over. The pandemic is not over anywhere until it's over everywhere. In fact, cases are increasing in more than 70 countries. At the same time, testing rates globally are plummeting, making us blind to the evolution of the virus. And almost 1 billion people in lower income countries remain unvaccinated. We must continue to support all countries to reach 70% as soon as possible, with a focus on those most at risk. Vaccine supply has improved, but absorption has not kept pace due to insufficient political commitment, operational capacity, and finance, combined with vaccine hesitancy driven by mis and disinformation. Our biggest challenge now is supporting in-country delivery of vaccines. For tests and new therapeutics, the problems are supply side with insufficient funds and insufficient access. The ACT Accelerator is the best way to get life-saving COVID-19 tools to the countries that need them, but it faces a $15 billion shortfall. WHO's own strategic preparedness response readiness plan, our comprehensive roadmap for ending the pandemic, likewise faces a shortfall of $1 billion. I thank President Biden for his announcement that the United States will license several innovative technologies to CTAP. And I welcome yesterday's announcement of the new $1 billion Global Health Workforce or Worker Initiative. At the World Health Assembly this month, WHO will present a plan to strengthen the global architecture for health emergency preparedness, response, and resilience. This includes the creation of a financial intermediary fund to support equitable access to life-saving tools in the face of future epidemics and pandemics. I leave you with 4 requests. First, we call for policy commitments to boost vaccination, testing, and treatment in countries. Second, we call for investment in local production. Third, we call for financial commitments to fully fund the ACT Accelerator and WHO Strategic Preparedness, Readiness, and Response Plan. And fourth, we call for political commitment to support the Financial Intermediary Fund and the new architecture for global health security. I thank you, and Ambassador Greenfield, back to you.
Those insightful comments. Our next speaker has been a champion in the COVID-19 response and in building global health capacity within his own country, across Africa, and in the African Union and around the world. His country continues to make significant commitments to the response. And South Africa has once again stepped up for this summit. President Matamela Cyril Ramaphosa, you have the floor.
Thank you, Ambassador Greenfield, President Joe Biden, Vice President Kamala Harris, fellow heads of states and friends. This second global summit on COVID-19, for which we thank the co-hosts for bringing us all together, takes place at a time when vigilance is required of all of us. As the international community, we are all working towards a swift social and economic recovery, but the threat of new waves and the emergence of new variants is ever present because COVID-19 is not over yet. To avoid a return to the catastrophic early days of the pandemic, we need to get many more people across the world vaccinated. We need to expand access to testing and treatment. We also need to be better prepared for future health crises and generate the financing to do so. South Africa, therefore, supports the formation of the fund as a mechanism to finance global health security. The global health recovery will not be inclusive so long as millions of people in developing economy countries remain unvaccinated. Africa has one of the world's lowest vaccination rates at 16%, and coverage in low-income countries is still under 13%. As African leaders, we are committed to achieving a higher rate of vaccine coverage through mass campaigns across the continent. We continue to advocate for a TRIPS waiver in the WTO to improve global access to vaccines, therapeutics, and diagnostics so that the objective of having locally made vaccines is achieved. To get more life-saving vaccines to those in need, South Africa is donating 5 million doses of Pfizer vaccines and 10 million doses of J&J vaccine to other African countries to pledge our solidarity with those countries that are not able to access vaccines easier. South Africa has contributed $10 million to the Global Fund and plans to contribute financial support to the ACT Accelerator as well. To address low testing rates, African Union member states have committed to target a 200 million COVID tests by the end of 2022. At the same time, we will be implementing the Africa CDC's enhanced surveillance strategy for community-based testing, wastewater testing, and sentinel surveillance. The African Union Summit in February endorsed a common agenda for manufacturing vaccines, medicines, diagnostics, therapeutics, and health products on the continent. The continent's largest COVID-19 vaccine manufacturing plant opened in South Africa last year, and the WHO supported South Africa to become the center of the mRNA process and to have hubs for tech transfer in other countries such as Egypt, Senegal, Tunisia, Kenya, and Nigeria. However, this progress may be reversed because international agencies that have had a lot of money donated to for purchasing and procuring vaccines for developing economy countries are not buying vaccines from African vaccine manufacturers, even for those vaccines that are destined for African countries. This immediately just devalues the whole process of local manufacturing and local production of vaccines. This, ladies and gentlemen, must change. Multilateral agencies and also philanthropic organizations need to be procuring vaccines and boosters from African vaccine manufacturers to ensure that developing capabilities on the continent are retained. And as we heard from President Marquez, a number of African countries are now stepping up to produce vaccines for the 1.3 billion Africans who live on the African continent. And it is for this reason that we are calling for vaccines to be purchased for Africans on African soil. As South Africa and as the African Union champion for COVID-19 response, we call on the international community to ensure that solidarity and equity underpin this next phase in our management of the pandemic. This means that vaccines produced in Africa must be procured in Africa for Africa's people. This is vital for the continent's health security now and into the future. I thank you.
Thank you, President Ramaphosa. I'd like to introduce our next speaker, Canadian Prime Minister Justin Trudeau. Canada is a global leader in enhancing health security and financing the COVID response. And we understand he has some new announcements to make today. Mr. Prime Minister, you have the floor.
Thank you, Ambassador. Thank you to my friends Cyril, Pedro, John, and Maki for being here today. And thanks to President Biden and to you, Vice President Harris, for bringing us all together. For decades, Canada has been a strong supporter and advocate for global health. Over the past 2 years, the pandemic has shown us how interrelated we all are. Cette pandémie va seulement pouvoir se terminer quand tout le monde aura accès.
This pandemic will only end when everybody have access to enough tests, to therapeutics, and to vaccine. And the ACT-A accelerator certainly is our best tool in order to ensure that there is cohesion and cooperation between the various countries.
Canada has provided vaccine doses to countries who needed them. And we've made investments to help enable development and production of mRNA vaccines, which includes up to $15 million towards the establishment of the COVID-19 mRNA Technology Transfer and Manufacturing Hub in South Africa that Cyril referred to. But however we might all be wishing it is, the pandemic is not over. And as it persists, it changes. So does our global context. That's why we must continue to adapt our response. For example, supply is no longer the key constraint to COVID-19 vaccination globally. Countries face difficulties getting vaccines from tarmacs into arms, particularly for vulnerable populations and people in remote communities. Well, Canada's going to be there with support. We also look forward to continuing to work with all of you to ensure people have what they need to make informed decisions on vaccines. Together, we have to reinforce the continued importance of testing and treatments. This will help us identify dangerous variants and contain outbreaks. And we must be better prepared for the future by identifying and filling gaps in the international health landscape. The G7, the G20, and the private sector, everyone needs to do their part to support the ACT Accelerator. Today, I'm announcing new funding of $732 million for the ACT Accelerator. This includes funding to continue making COVID-19 vaccines available and funding to help low and middle-income countries support the health of women, children, and adolescents. Once again, Canada is immediately meeting its full burden share. We've now contributed a total of more than $2 billion to the ACT Accelerator since the start of the pandemic. J'encourage tous les autres pays à soutenir
I
les
strongly
efforts.
encourage all countries to support international efforts and to do their part. Indeed, it's by working together that we will be able to build a better future, protect the most vulnerable people, implement prevention, and ensure that our economies are more resilient.
So we can end this pandemic for everyone, everywhere. Merci, mes amis.
Thank you, dear friends.
Thank you, Prime Minister Trudeau, and congratulations on your leadership. I hope others will follow your lead. I'd like to introduce our next speaker, Ms. Joy Pumampi, who is the Interim Co-Chief Executive Officer of the Clinton Access Health Initiative. She is also a former Minister of Health of Botswana. She will be delivering a commitment today on behalf of her organization, as well as companies that she has been working with to expand access to tests and treatments for COVID-19. Ms. Pumampi, you have the floor.
Thank you so much, Ambassador. Your Excellencies and distinguished guests, the COVID-19 pandemic has taken an enormous toll on health and lives globally, making equitable access to effective oral antiviral medications, especially for those who are high risk, critical. Today, CHAI is announcing new agreements with leading generic manufacturers to make generic Paxlovid available in low and middle income countries for under $25 per treatment cost, ensuring equitable access that will save lives and reduce the burden on struggling health systems. Participating companies are well-established and trusted suppliers to the US PEPFAR. As leaders in the HIV antiretroviral market, they represent over 25% of global low and middle-income public sector procurement volumes per year. Under the agreements, the companies will guarantee production of an affordable generic version of the drug and dedicate capacity for 4.5 million treatment courses per month for low and middle income countries covered by their licensing agreements with the Medicines Patents Pool. Manufacturers will work to file for WHO pre-qualification or approval from a stringent regulatory authority like the US Food and Drug Administration by the first quarter of next year, and will register the product widely across licensed territories. In turn, CHAI will work with donors and our partner governments to raise procurement funding and pursue advanced purchase commitments to meet country needs. Partners like South Africa, like Zambia, like Nigeria are ready and able. They have demonstrated successful introduction of HIV treatments, such as the dolutegravir, which has been introduced, rolled out, and scaled up to millions of patients. Working together and through existing government systems and in collaboration with UNITAID, with WHO, the Global Fund, and ACT-A partners, CHAI will provide technical and strategic support to countries to integrate introduction of the medication with existing testing plans that align with their national COVID-19 response, building capacity for decentralized testing and treatment of high-risk patients by updating clinical guidelines, supporting national level procurement planning, and engaging implementing partners and communities to align on product introduction and scale up. Catalytic efforts by global partners are also necessary. Funding for operational research and initial rollout of test and treat approaches from partners such as UNITAID and FIND will be critical to provide the data to scale up efforts. Funding for procurement of rapid diagnostics tests, medications by the Global Fund, UNICEF, the US government will accelerate entry of affordable, quality-assured genetic products. We call on the international community to commit funding to making these treatments equitably available to end the pandemic and build resilient systems that can withstand future health crises. We thank you, Excellencies, the Global Fund, Unit 8, the UK government for their support, and want to acknowledge the leadership and contributions from the Act A diagnostic and therapeutic pillars. We thank you.
Thank you, Ms. Pumapi. That commitment could be game-changing, and I would like to thank you for your leadership in making it happen. Now I'd like to introduce our next speaker, India's Prime Minister Narendra Modi, to share India's new commitment to the pandemic response and your views on the future of pandemic preparedness. Mr. Prime Minister, you have the floor.
President Biden, Vice President Harris, Excellencies, Namaskar. The COVID pandemic continues to disrupt lives, supply chains, and test the resilience of open societies. In India, we adopted a people-centric strategy against the pandemic. We have made the highest ever allocation to our annual healthcare budget. Our vaccination program is the largest in the world. We have fully vaccinated almost 90% of the adult population and more than 50 million children. India manufactures 4 WHO-approved vaccines and has the capacity to produce 5 billion doses this year. We supplied over 200 million doses to 98 countries bilaterally and through COVAX. India has developed low-cost COVID mitigation technologies for testing, treating, and data management. We have offered these capabilities to other countries. India's Genomics Consortium has contributed significantly to the global database on the virus. I'm happy to share that we will extend this network to countries in our neighborhood. In India, we extensively use our traditional medicines to supplement our fight against COVID and to boost immunity, saving countless lives. Last month, we laid the foundation of WHO Center for Traditional Medicine in India with an aim to make this age-old knowledge available to the world. Excellencies, it is clear that a coordinated global response is required to combat future health emergencies. We must build a resilient global supply chain and enable equitable access to vaccines and medicines. WTO rules, particularly TRIPS, need to be more flexible. WHO must be reformed and strengthened to build a more resilient global health security architecture. We also call for streamlining WHO's approval process for vaccines and therapeutics to keep supply chains stable and predictable. As a responsible member of the global community, India is ready to play a key role in these efforts. Thank you. Thank you very much.
Thank you, Prime Minister Modi. I'd like to introduce our next speaker, Spanish President Pedro Sanchez. Spain has also stepped up for this summit, and we look forward to hearing from you. Mr. President, you have the floor.
Thank you, President Biden, for co-hosting this very important summit and for inviting Spain to participate. My dear friends, the worst of the pandemic may be behind us, but it is not over yet. And there are lessons to be learned for future health crises. If global health is a public good, and no one would question that now, then we must act accordingly. In 2020, our main aim was to develop an effective vaccine against COVID-19. In 2021, the challenge was to produce and distribute it across the world. Today, in 2022, we need to get those shots in people's arms. Spain has managed to reach one of the highest vaccination rates globally while becoming one of the largest donors. We are the 7th largest vaccine donor to the COVAX mechanism and the 2nd largest donor in Latin America. But much remains to be done, which is why this summit is so timely. I would like to announce the following new commitments. First, Spain will allocate an additional $200 million in order to donate 30 million vaccines through COVAX and bilaterally. This will add to the 70 million doses already delivered. Therefore, if epidemiological conditions require it, Spain will donate a total of 100 million vaccines. Second, we must strengthen health system to achieve our goals. This is why Spain will commit 100 million euros to COVID-19 related development projects that will be implemented by the Spanish Agency for International Development Cooperation. In order to get better prepared, we must develop vaccines against new variants that might extend the duration of the pandemic. In this regard, my country, Spain, is supporting the development of a new protein-based vaccine by IPRA Human Health, which will be particularly effective. We must also improve global mechanism to transfer technology and decentralize production of health products across regions. For that reason, Spain joined the World Health Organization's COVID-19 Technology Access Pool, CTAP. And last November, the Spanish National Research Council finalized a licensing agreement for a serological antibody technology. This was the first transparent global non-exclusive license for a COVID-19 health tool. The World Health Organization described it as one of the top 10 global health landmarks in 2021. And we are also supporting concrete efforts for vaccine productions in Latin America. Last but not least, we have to protect, safeguard, and invest in health and healthcare workers. This is why Spain is co-leading the line of effort within the framework of the Global Action Plan developed by the US and other partners. We must act together, and Spain is ready to do so. Thank you very much. Gracias.
Thank you, President Sanchez and Spain, for your impressive new commitment and continued leadership. Let's keep it going. Now I'd like to introduce our next speaker, European Commission President Ursula von der Leyen, who is bringing another large new commitment to the summit.
Mr. President, dear Joe, Mrs. Vice President, thank you for calling the second Global COVID-19 Summit. Today's presence of leaders from across the world is a powerful signal. No issue is more important than people's well-being. We cannot be complacent because the pandemic is not over. Of course, safe and effective vaccines and better treatments have much reduced the pressure on our healthcare systems. And restrictions in many parts of the world are being lifted. But new variants will continue to emerge, and there is no guarantee that the next one will be mild. In addition, we must prepare for future pandemics or other health threats beyond COVID. So in the European Union, we are working hard to step up surveillance, strengthen our healthcare systems, and improve preparedness. None of us can do this alone. And this is why international cooperation and solidarity have been at the heart of our EU's response from the very beginning. Until now, Europe exported 2.2 billion doses of vaccine. In addition, Team Europe helped to set up and fund the ACT Accelerator and shared 470 million vaccine doses so far, because we know global cooperation, including our EU-US partnership, is vital to end this pandemic. We teamed up in our fight against COVID at the first summit in September. The joint statement we're making today proves that our close cooperation is advancing the global effort to end the pandemic. At our last meeting in September, we focused on sharing supply and local production, as well as on ensuring sustainable financing. Now we must take our commitment to the next level. The supply of vaccines has to go hand in hand with speedy delivery, especially in Africa. Today, I can announce that the European Commission makes a financial commitment to enable vaccine delivery in the countries in need. I also make a financing pledge to support the work of ACT Accelerator on diagnostics, therapeutics, and health systems. In addition, we make sure that all regions have the capacity to produce their own medicines locally. The recent agreement in the G20 to move ahead with a global pandemic preparedness fund is an opportunity for the global community. We will work together with the US and other partners to make it fit for purpose. I can announce today that the Commission envisages a significant contribution to this fund as soon as its governance is established. Ladies and gentlemen, the development of safe and effective vaccines in record time was an unprecedented achievement in the history of science. And it was international cooperation that made this success possible. I'm sure, Mr. President, dear Joe, that our summit today will strengthen the global cooperation we need.
Thank you, President von der Leyen. Your commitment speaks volumes about European unity in defeating the pandemic and preparing for the next. We now have several early financial commitments to capitalize on the political momentum that has been building and to continue growing commitments as we establish the Pandemic Preparedness and Global Health Security Fund this summer, in line with the Indonesian G20 presidency goals. But we cannot stop there. I want to call on all of you to support this effort politically, financially, and as the President said, now. I'd like to introduce our next speaker, President of South Korea, Yoon Sakyal. President Yoon comes to us from a pre-recorded message, but I want to wish him congratulations on his recent election.
Mr. President, Excellencies, ladies and gentlemen, it is an honor to take part in the Global COVID-19 Summit right after my inauguration as the 20th term President of the Republic of Korea. 2 years ago, WHO has declared COVID-19 outbreak a global pandemic. Since then, there have been multiple global efforts to overcome this crisis. The Republic of Korea has participated in joint efforts of the international community to win the battle against COVID-19 and to build a sustainable global health system. We will remain committed to supporting the international community's efforts to end this pandemic. The Republic of Korea will play its role and fulfill its responsibility. In this regard, Korea will contribute additional $300 million to ACTA We will provide assistance to countries who are in urgent need of vaccines so that they can have enough doses of vaccines and have their people vaccinated safely and promptly. In addition, we will do our best to support developing countries move toward vaccine self-sufficiency by establishing WHO BioHub to train global bio-experts. With a view to strengthening international coordination, Korea will actively participate in global health security agenda as well. The Republic of Korea supports the establishment of Financial Intermediary Fund. FIF will enable the international community to mobilize sufficient resources in time so that we can be fully prepared to deal with future health crises such as new infectious diseases. Excellencies, ladies and gentlemen, global health crises like COVID-19 pandemic, which threaten the whole humankind, cannot be resolved by the participation of just one or a few nations. When more states work together in solidarity, we will be able to prevail over the challenges. The Republic of Korea will play its role as a responsible member of the international community. Working together is the right way to bring prosperity for humanity. I expect that through the second Global COVID-19 Summit, we will be able to find out better ways to overcome COVID-19 and strengthen global health security system. Thank you.
Thank you, President Yoon. It says a lot about South Korean leadership that this is one of your first acts in office. I'd like to introduce our next speaker, Colombian President Iván Duque Marquez, who will provide an additional perspective on enhancing vaccinations for the most vulnerable in his country and region. Mr. President, you have the floor.
My greetings to the President of the United States, Joe Biden, also to the German Chancellor Olaf Scholz, the Prime Minister of Belize, and the Presidents of Indonesia and Senegal. My greetings are also extended to all the participants in this event. Since its inception, this summit has been an opportunity for the world to move forward together on the joint commitment to overcome the crisis generated by COVID-19. All countries are encouraged to contribute to the best of their ability to secure funding for a multilateral response to the problems caused by the pandemic. In Colombia, we continue to provide a response aimed at protecting the most vulnerable, safeguarding the health of the population, and reactivating our economy. As a result, we have strengthened our healthcare capabilities. Consequently, thanks to the National Immunization Plan, we have succeeded in immunizing 83% of all Colombians with at least one dose. Likewise, almost 70% have been fully vaccinated. We have also made progress immunizing the Venezuelan migrants. Today, more than 600,000 of them have been vaccinated. For Colombia, equal access to vaccines is our priority. For this reason, we contributed $1.2 million to the Pan American and World Health Organization support vaccination in CARICOM countries. This is in addition to the technical assistance we have provided in the region based on the Colombian experience. In this regard, Colombia is recovering its sovereignty in the production of vaccines. The construction of a plant has already started in Colombia, with which we will be able to manufacture develop vaccines against COVID-19 and other diseases, allowing us to be better prepared for future health emergencies. Today, we are renewing our commitment to the vaccination process. Our goal is to continue sharing the best practices that have allowed us to move forward with our national plan. Likewise, we continue our call to strengthen the global health security architecture with transparent, inclusive, and collaborative processes. Colombia will continue to contribute to the discussion held by the World Health Organization to strengthen prevention and preparedness for pandemics, a call that is vital for our global future. Thank you very much for your support, and thank you very much for putting together this amazing summit in which we all contribute to strengthen the world healthcare system.
Thank you, President Duque Marquez. This is another example of a commitment that is vital to make, and we hope more countries can make similar commitments. The challenges posed by migration crises around the world are being exacerbated by the pandemic, and making commitments to make vaccinations and care available for these populations in humanitarian settings are so vital. I'd now like to introduce our next speaker, New Zealand Prime Minister Jacinda Ardern, whose swift and efficient COVID-19 response and recovery efforts made New Zealand a model for the world on effectively isolating the pandemic. Madam Prime Minister, you have the floor.
Tēnā koutou katoa. Greetings from Aotearoa, New Zealand. Thank you to the United States, Senegal, Germany, Indonesia, and Belize for hosting this summit to strengthen our collective efforts to end the COVID-19 pandemic as soon as possible for everyone, everywhere. President Biden, thank you for your leadership and for highlighting the importance of taking action now to fill urgent gaps in the international response to the current pandemic and future global health crises. Vaccines remain a critical tool in our collective response to the pandemic, and COVAX is at the center of these efforts. While the global supply of vaccines has increased, significant challenges remain in turning these vaccines into vaccinations. At the same time, countries need to be able to access the tools they need to respond to the pandemic and build strong and resilient health systems, including testing, therapeutics, oxygen, and PPE. Aotearoa New Zealand continues to play our part. In this funding period, we have contributed over 14 million New Zealand dollars to the COVAX AMC for vaccine delivery and support, including fully funding all ancillary costs associated with our donations of 7.3 million doses of COVID-19 vaccine. In March, we pledged a further $10 million to CEPI over 5 years to support its continued work to develop COVID-19 vaccines and to prepare for future pandemics. Today, I'm pleased to announce we will increase our contribution to the ACT Accelerator by an additional 10 million New Zealand dollars for a total contribution of almost 70 million. 8 million will be directed to the Global Fund's COVID-19 response mechanism to support diagnostics, therapeutics, and health systems strengthening in developing countries. And over $2 million will be provided to UNICEF for the purchase of medical equipment in Vietnam and to maintain essential health services in the Philippines. Aotearoa New Zealand is committed to supporting global equitable access to COVID-19 vaccines and ensuring health systems in developing countries are supported to achieve widespread vaccination. We join the call for all donors and vaccine suppliers to work to ensure the maximum possible shelf life of donated COVID-19 vaccine doses, which is critical to making the fullest use of available supply. Together, with broader efforts to support health systems to deliver COVID-19 vaccination programs, this will help to better protect all populations from COVID-19. We also remain fully committed to supporting global efforts to prevent, prepare, and respond to future pandemics, with the World Health Organization playing a central role. Today, I'm pleased to announce Aotearoa New Zealand's in-principle support for a new global health security fund for pandemic preparedness and response. We look forward to engaging with others on this initiative. In addition, we will continue our close and constructive engagement at the World Health Organization to strengthen the international health regulations and negotiate a new international instrument for pandemic prevention, preparedness, and response. Alongside our contributions to multilateral efforts to end the acute phase of the pandemic, we're committed to supporting the needs of countries in the Pacific region. In partnership with Pacific neighbours, we're providing fiscal budget support, outbreak management support, and crucial equipment and supplies, including vaccines, testing kits, oxygen, and PPE. Through the Polynesian Health Corridors Program, we've been proud to support the 6 Polynesian countries and Fiji to achieve excellent vaccination coverage through bilateral donation and to share our technical knowledge and experience of responding to COVID-19 so we can all learn from each other. We must also do all we can to end the current pandemic as quickly as possible. We also need to prepare for future global health crises. Only by working together can we do both. E hara taku toa, e te toa takitahi, inare he toa takatini. Success is not the work of one, but the work of many. Thank you.
Thank you, Prime Minister Ardern. I'd like to introduce our next speaker, Italy's Prime Minister Mario Draghi. Prime Minister Draghi, you led the G20 last year and helped bring the leading economies through sustained crisis. Thank you for your continued leadership on these issues.
President Biden, colleagues, it is a great pleasure to be at this second Global COVID-19 Summit. I would like to thank President Biden and all the organizers for hosting this important meeting. The development of effective vaccines and the organization of successful vaccination campaigns have marked a turning point in the fight against pandemia. In many of our countries, we have removed restrictions, reopened schools, restarted the economy. We have saved lives, and we have returned to a normal life. But as we know all too well, the pandemic is not over. Since the start of the year, we've had an average of 1.7 million COVID-19 cases a day worldwide. We're still behind our shared objective of vaccinating 70% of the population in all countries by mid-2022. The vaccination gap is closing, but the coverage rate in some countries remains below 10%. Italy has already contributed to the multilateral response to the pandemic with 445 million euros and has already pledged 69.7 million doses via COVAX. Today, I can announce that Italy will donate an additional 31 million doses through COVAX, and we are also pledging 200 million euros via the ACT accelerator and in order to strengthen global preparedness. Italy's G20 presidency has launched a joint finance health task force to explore a new facility to fund pandemic prevention, preparedness, and response. It is essential to achieve a broad consensus on an inclusive facility with the WHO at its center in order to ensure its effective implementation and a broad-based financing. Italy is strongly committed to ending this pandemic and to preventing future ones. We stand ready to continue working together with urgency and determination. Thank you.
Thank you, Prime Minister Draghi. I'd like to introduce our next and final speaker for this session, Japan's Prime Minister Fumio Kashida. Japan remains a leader in global health, and you have been at the forefront of supporting multilateral efforts like Act A. We welcome your remarks to hear how Japan will continue these commitments.
バイデン米国大統領、ブリセーニョ・ベリーズ首相、ショルツドイツ首相、ジョコインドネシア大統領、サルセネガル大統領、ご参加の皆様、 新型コロナがパンデミックと宣言されてから2年以上経つ今も、世界の至るところで人々の健康が脅かされ、経済社会の発展が阻まれています。我々はこのパンデミックを終焉させ、より良い健康安全保障を構築し、ユニバーサルヘルスカバレッジを達成すべく、具体的な取り組みを加速させていかなければなりません。日本は米国主導のグローバル行動計画の中で、特に世界におけるワクチン接種の促進のリード国として貢献しています。COVAX に対し拠出済みの10億ドルに加え、最大5億ドルの追加支援を行います。また、CEPI に対し、今後5年間で3億ドルを新たに拠出します。さらにこれまで実施した約4400万回分のワクチンの現物供与に加えて、各国地域における輸送接種体制を強化するラストワンマイル支援を計77カ国地域に広げ、約 1.6 億ドル規模で実施してきています。ワクチンを含む医薬品、医療品の現地生産能力強化も重要であり、今般アフリカにおける能力強化のため、JICA を通じて最大2億ドルの支援を行うことを決定しました。これらの取り組みがより一層効果的にワクチン接種の促進につながるよう、現場での連携強化にも貢献していく考えです。日本の新型コロナ感染症対策に関する途上国支援は、これまでに総額約45億ドルとなり、先に述べた COVAX に対する最大5億ドルの拠出と合わせ、約50億ドルの支援を力強く実施していきます。また、より良い健康安全保障の構築に向け、将来のパンデミックへの予防、備え、対応を強化するためのグローバルヘルスアーキテクチャの強化に積極的に貢献していきます。このため、国内資金動員のさらなる促進や、既存機関の活動を補完する資金メカニズムとして、世銀に新たな基金を設立することを指示します。WHO 改革、パンデミックに関する新たな国際文書の策定や国際保健規則の改正にも積極的に関与していきます。日本は日米豪印首脳会合、TICAD8、来年の G7 をはじめ、日本が主催する関連会合も念頭に、UHC の達成に向け、引き続きリーダーシップを発揮していく決意です。ありがとうございました。
Thank you, Prime Minister Kashida, for closing us out particularly strongly with those impressive commitments. And thank you all for your insightful comments and the spirit of collaboration this group has shown today as we come together to end this global pandemic. I'm encouraged by the leadership and the political and financial commitments we've seen so far this morning. With everyone's hard work, we can continue to make ending the pandemic a top priority, even as we simultaneously deal with other crises. And if there's one thing I'm taking away from this first session, it's that as we tackle COVID-19 and save lives, we also have to ready ourselves for future threats. Every single country has a role to play in this fight. We must come together to ensure testing and treatment is accessible to all, to support heroic frontline healthcare workers, and to strengthen our public health infrastructure. And while we're making real progress in our efforts to vaccinate the world, we know that too many people are still out of reach, especially those living under conflict and instability. This is an issue the UN Security Council took up just last month, and I'm glad to see it's the focus of today's next session. I look forward from hearing the next group of leaders on how we can all facilitate access to vaccines for the vulnerable and hardest to reach populations around the world. Thank you.
Monsieur le Président des États-Unis d'Amérique, Mesdames et Messieurs les chefs d'État et de gouvernement,
President Joe Biden, heads of state, ministers, ladies and gentlemen, it's been 2 years now that we've been plunged in this global pandemic crisis, which has been unprecedented due to its scope and due to its consequences in the lives of our nations and at an international level. Of course, we all hope to see the end of this pandemic, but we also know that unfortunately, the pandemic continues to constitute an important threat for our health and for the balance of our societies. We have given ourselves the means to move towards the goal that we've set for ourselves, to ensure that the COVID-19 vaccine becomes a new common public good. This is a battle based on shared solidarity and responsibility. And France and the Europeans have been at the forefront of a new multilateralism based on action and results by playing a driving role in the creation of ACT A and COVAX. And by donating more than 500 million doses of the vaccine to the most vulnerable countries. However, the contamination rates remain extremely concerning in certain regions of the world, and the emergence of new variants could cause a global resurgence of the epidemic. That is why it is essential for us to continue with our efforts in order to take up this challenge of the last 1 mile support. We need to step up vaccination campaigns. We need to improve access to tests and to treatment, all the while strengthening our health systems to make them more resilient. We need to support healthcare workers in performing their jobs, as we have done in the city of Lyon. We have just established the new WHO Academy, which will train thousands and thousands of people worldwide on health-related matters. And of course, we also need to learn the lessons from what we have just experienced in order to prepare ourselves for the health crises of the future. We will do this by working on strengthening the global health architecture based on the WHO and by advancing the negotiations of a future international agreement on the pandemic. Well aware of these major challenges, France will provide a contribution of 220 million to support these efforts. We will also contribute 100 million euros to COVAX in order to support vaccination campaigns in the field. We will donate doses and also to support the creation of a pandemic vaccine pool. We will contribute $50 million to the WHO action in the context of ACT A. And finally, we'll contribute we'll contribute 70 million euros to strengthen the vaccine manufacturing capability of our partners in the South, who quite legitimately wish to reinforce their own sovereignty in that area. We're already working alongside them in Rwanda, Senegal, and South Africa, where we have been supporting the creation of mRNA vaccine manufacturing hubs. We also encourage the continuation of discussions engaged at the multilateral level regarding intellectual property issues, particularly with the WHO. In addition to its 220 million euros, in 2020, we have donated 60 million additional doses, which is equivalent to 370 million additional euros. Therefore, I am today happy to announce a total of nearly 600 million euros in support from France in order to fight COVID-19. And this has enabled us to tackle the pandemic. And what has enabled us to tackle the pandemic is our determination to work together. And this should continue to be our compass.
Distinguished delegates, Thailand wishes to make the following 6 points of pledges which build upon what we have announced during the first COVID-19 summit in September last year. First, Thailand plans to donate over 3.3 million doses of COVID-19 vaccines worth $14.5 million in 2022. So far, we have already donated 1.3 million doses, including syringes and needles, to our neighboring countries. Additional donations of 2 million doses are in the pipeline. They will be allocated across various countries that have COVID-19 vaccine shortages. Second, Thailand's universal health coverage scheme makes COVID-19 tests, vaccinations, and treatments accessible to every person living in our country, regardless of nationalities or immigration status. We have made good on our pledge at the first summit on providing universal vaccination within Thailand. In fact, we have achieved higher vaccine coverage than the target set. To extend our national vaccine coverage to the widest extent possible, health authorities are proactively reaching out to groups not yet vaccinated, such as migrant workers in hard-to-reach areas. We also commit to protecting our high-risk population through the administration of booster shots. Third, Thailand pledges to continue working on disease prevention and health emergency preparedness through a number of capacity-building projects in our neighboring countries and beyond. We are confident that we can deliver on this pledge, since we can build upon Thailand's existing and robust framework on international health cooperation and development. Fourth, Thailand stands ready to cooperate with global partners on vaccine testing, research and development, and production. We look forward to registering one of our homegrown vaccines in the first quarter of 2023 and scaling up to its production such that we will be able to contribute to the global vaccine supply. Fifth, Thailand has pledged to provide multi-year financial contributions to the Global Fund to fight HIV, tuberculosis, and malaria for the sum of $7.5 million or $1.5 million each year from 2020 to 2024. We are pleased to see that for the past 2 years, the Global Fund also has played a crucial role in supporting many countries around the world in the fight against COVID-19. Sixth, Thailand supports the principle, the United States initiative to establish the Global Health Security Financial Intermediary Fund, or FIF, under the World Bank. Thailand is convinced that the FIF will help galvanize global support to further strengthen global health security and enable all countries to better prepare and respond to the future global health emergencies. Lastly, along with those mentioned 6 points of pledges, Thailand wishes to call on global leaders to unite in the spirit of closer cooperation and take bolder steps to end this pandemic and build back better, stronger.
Now introducing Rita Roy.
Excellencies, honorable ministers, and distinguished panelists, good morning and good evening, and welcome to the second session of the second Global COVID-19 Summit. Our session is entitled Getting Vaccines to the Most Vulnerable. My name is Rita Roy, and I'm the President and CEO of the MasterCard Foundation, and I'm honored to serve as your moderator for this session. Last year, the MasterCard Foundation and the Africa CDC launched a $1.5 billion initiative called Saving Lives and Livelihoods. It was intended, and it still is ongoing, to purchase and deliver vaccines to millions and millions of people across Africa. It was also set up to lay the groundwork for vaccine manufacturing in Africa and to strengthen the Africa CDC. And early on, Our commitment enabled the African Vaccine Acquisition Task Team to secure up to 500 million doses of vaccines for the continent. And as vaccines begin to stream in, we must and we will double down on delivery. And delivery means getting vaccines into the arms of citizens. And that includes everything from transportation, working on the cold chain, setting up vaccination centers, training healthcare workers, supporting pharmacovigilance, and also enabling the genomic sequencing of the virus as it continues to modify itself. Across the world, we are making progress, and yet across the world, we have a long way to go. Last year, at the first global COVID-19 summit, about a third of the world's population was fully vaccinated. Today, we can say that 60% of the global population has been vaccinated. But as we look below those numbers, whether in Eastern Europe, in Asia, and in Africa, the vaccination rates remain worryingly low. In some cases below 10%, even 5%. So we know it's far too soon to declare victory. It's far too soon to say that we can move on from COVID-19. We need a strong push for universal vaccination to protect every life, to protect everyone. There are still people who remain far too vulnerable to this virus. The elderly, those who are immunocompromised, those who live in rural communities, those with pre-existing conditions, people who are displaced, people who are refugees. And in the case of the continent of Africa, we have a very young population. More than 60% are under the age of 25. So today we need to do more, and we need to continue to do more, and we will hear from work that is happening around the world. Let me acknowledge and thank our co-hosts for this session, and we will be hearing from them shortly. The Honorable Abdullahi Diouf Sarr, the Minister of Health and Social Affairs for Senegal, the Honorable Annalena Baerbock, the Minister of Foreign Affairs for Germany, and Administrator Samantha Brown of USAID. Thank you for hosting us. I also want to acknowledge and introduce our distinguished panel from whom we'll be hearing shortly. And it's my honor to warmly welcome the Honorable Dr. Osaji Ehanire, Minister of Health of Nigeria, Dr. Tunji Funjo, a Rotarian volunteer of Lekki Phase 1 at the Rotary International, Dr. Richard Hatchett, CEO of the Coalition for Epidemic Preparedness Innovations, otherwise known as CEPI, His Excellency Billawal Bhutto Zardari, Minister of Foreign Affairs of Pakistan, Her Excellency Umi Ali Mwalimu, the Minister of Health of Tanzania, Dr. Seth Berkley, the CEO of Gavi, the Vaccine Alliance, and His Excellency Uha Bella Gafar, the Minister of Health for Palau. I thank you all for making your time, and we look forward to hearing from you. But before we get started, let me first hand over to our hosts for today for their welcoming remarks. Honorable Minister Abdullahi, let me turn the floor over to you, sir.
Je vous remercie.
Thank you so much. It's indeed with immense pleasure that I'm taking part in this session, which focuses on vaccinations, and this during the second global COVID summit. Vaccination indeed appears as the safest and most effective method in order to combat this pandemic, in order to reduce the virus's transmission chain and to avoid the emergence of serious cases. And that is why, under the leadership of our President Marquez, President of the Republic of Senegal, very early on, Senegal has implemented a national strategy to combat COVID-19. This began on February 3rd, 2021, with the acquisition by the government of Senegal of an important amount of vaccines. In this context, there are various agreements that have been passed in the 14 regions of the country and in the 79 health districts of Senegal, so as to reach the target population, that is to say, people over the age of 18. Thanks to our own equity, but also thanks to the support of financial partners, we have been able to receive various types of vaccines: AstraZeneca, Sinopharm, Pfizer, Moderna, J&J. Currently, we have a wide availability of various doses of vaccines in order to continue vaccinations until July 22, at the least. I would like to thank the partners of the COVAX initiative who have been facilitating access to COVID-19 vaccines. This initiative is the symbol of global solidarity in order to combat the COVID-19 pandemic. I'd also like to thank all of our bilateral partners who have been supporting the rollout of our vaccination strategy. As of May 8, 2022, over 1.4 billion people in Senegal have received at least one dose of the vaccine. And so that is a significant amount of the target population. And 1,700,000 people have received full coverage. That is to say, about 11.46% of the civilian population. Senegal has validated the administration of a booster shot so as to strengthen people's protection against the virus. In addition, with the support of another institute, we are able to deliver an electronic verification certificate that has a QR code. And as such, we are fulfilling global standards in that area. Despite all the efforts deployed, nonetheless, the coverage rate remains low. And this is due to the low levels of the pandemic, less than 5 cases per day, but also due to the disinformation campaigns conducted by anti-vaxxers. In this context, our country has recently adopted a new strategy in order to accelerate vaccination. And this is really what needs to be done. We need to accelerate vaccination. And this is the goal of this new strategy. Here we intend to intensify awareness raising in order to encourage people to take up the vaccine, but also in order to place more responsibility and resources on the regions and on the health districts so that they can improve their mobile logistics to train health workers, but also to ensure proper management of vaccination data. This also includes a better structuring of the vaccination offer. The goal is to create a new momentum, a new commitment on the part of populations. We need to ensure that the local population seeks out the vaccine and takes up the vaccine. This is in order to, and we must meet this demand for vaccines, and we need to also avoid the expiration of doses. I would like to note that we are confronted with a situation in which the shelf life of the doses sometimes expires. Today, we're moving towards enhanced protection of the elderly, but also of people who have comorbidities or people who are disabled. To this effect, we will conduct grassroots initiatives with the strong implication of local stakeholders, with community leaders, amongst others. Such initiatives require a lot of human means, financial means, material means that are all significant. The government of Senegal has already committed to a manufacturing project for the vaccine with the Institut Pasteur. This project is at an advanced stage, and it is supported by various reforms in the pharmaceutical environment. As such, we have created the Senegalese Agency for Pharmaceutical Regulation. We would like to invite our partners to support our efforts all along our vaccination strategy so that altogether we can take up this challenge in order to eradicate COVID-19, thanks notably to vaccination. Thank you for your attention.
Thank you, Minister, and thank you for updating us on your incredible efforts. Let me now turn to the Foreign Minister of Germany, Minister Baerbock. You have the floor.
Administrator Power, Minister Saar, dear colleagues and friends, I'm delighted to co-host today's session. I'm speaking to you from Weissenhaus, northern Germany. This term actually means White House, which I think is quite fitting for today's meeting. Here at the German White House, I will receive my G7 colleagues in a couple of minutes for our foreign ministers meeting of the G7. The focus of our G7 talks obviously will be on Russia's war of aggression against Ukraine. We all agree that this watershed moment is really crucial for the whole world. Our strategic and security environment has changed dramatically. Unfortunately, the global fallout of the war is also reinforcing the impact of the pandemic. Therefore, I want to state clearly, it would be wrong to shift our attention away from the fight against COVID-19. The acute pandemic is not over. New waves can hit us everywhere around the world. We must therefore continue to do a global vaccination campaign, as we are only safe when everyone is safe around the world. Therefore, it remains the utmost importance to fund ACT-A and COVAX. They are our central multilateral tools for global distribution of vaccines and other medical goods. I underline Chancellor Scholz's call to close the remaining funding gaps. Even though vaccinations are now available to all countries, vaccination rates are still lagging behind. Lower income countries struggle to get these vaccines into people's arms. That is our challenge today. And this is why Germany has launched its Last Mile initiative. We are mobilizing almost $1 billion to help boost vaccination campaigns in 34 selected partner countries. We want to ensure that vaccines and other tools reach even the most vulnerable populations. It is important for all of us to pool our efforts and closely coordinate on the ground. This is why I've made the last mile efforts one of the priorities during this G7 presidencies of the foreign ministers. I will report back to my G7 colleagues later about this timely and important summit we are just having. As G7 presidency, I'm glad that we have agreed on a common action plan. The plan includes concrete commitments in the fields of vaccines, vaccinations, and vaccine production. I'm confident that we will achieve great results from both our White Houses across the oceans. I now look forward to hearing from you, and thanks again to our US colleagues and our summit co-hosts Belize, Indonesia, and Senegal. Your commitment and efforts in bringing us together today at this very important time is very crucial. Thanks a lot.
Thank you, Minister, and thank you for your words and for your leadership. I understand you will have to drop off soon, so I just want to thank you in advance. Let me now turn to administrative power. You have the floor.
Thank you, Rita, and hello, everyone. Thank you for attending the summit. Thanks especially to our session co-chairs, Minister Sarr of Senegal and Minister Baerbock of Germany. Great to hear from you, especially on the eve of such an important meeting there in your home country, where Secretary Blinken is joining you. We meet on a day in which, as Vice President Harris just mentioned, the United States has hit a very grim milestone that few of us ever imagined when we first heard of COVID-19. 1 million deaths. That devastation is compounded by the WHO's recent statement that COVID-19 likely claimed almost 15 million lives around the world. The scale of that loss is incalculable, but it reminds us of just how relentless an enemy we face. And it also reminds us that we cannot let up. There is a complacency that is emerging in many countries that says this pandemic is over. But we cannot just hope that Omicron is the last variant that takes precious lives and unleashes such human suffering. We have to work to make it such. The good news is that we have seen major progress since the first COVID-19 summit that President Biden chaired last September. We have eliminated the global shortfall in the supply of vaccines, as we've heard. There are now enough vaccines out there for everyone who wants a vaccine. And the world has also significantly boosted vaccine coverage. Lower middle income countries have increased coverage from 13% to 53% just since that summit last September. In the lowest income countries, though, we know vaccination remains a challenge. Yet even there,
we are demonstrating results. And above all, the frontline workers in those countries are demonstrating results. Last December, the United States launched the Global Vax Initiative, in which we surged resources to 11 countries in sub-Saharan Africa to support efforts to increase the uptake of COVID-19 vaccines, to get the shots from the tarmacs into arms. This entailed everything from helping national vaccination campaigns, to building additional cold chain capacity, to creating mobile vaccination sites, to fighting misinformation, and, as has been discussed, the perception that COVID wasn't much of a threat. Working in partnership with these countries is leading to really concrete results. In Ghana, one of our global vax surge countries, the percentage of eligible people fully vaccinated more than doubled between December and April, from 12.4% to 25.4%. In Uganda, another surge country, the country jumped from a coverage rate of 20% of eligible adults getting one dose to 71% having received one dose. And that leap was just between November and April. So now is not the time to back down. It is the time to push ahead, even if this fight may drag on longer than any of us want. We have to be prepared to sustain the global vaccination effort well into 2023. For donor countries, including the United States, that means we need to keep investing in shots in arms support. We have to focus on boosting vaccination coverage globally, especially, as we've heard, among high-risk populations like the elderly, the immunocompromised, and health workers, some of whom have still not been vaccinated. Bringing high-risk populations up over 90% coverage is the most powerful way to decouple COVID death rates from case rates. And as we vaccinate more and more of the world, we can better support the critical effort of testing and treating those infected with COVID-19 and invest in preventing future pandemics. Today, USAID is committing $20 million to launch life-saving test and treat strategies targeting those at the highest risk of contracting COVID-19, while also planning to invest $200 million in a new fund to prevent future pandemics and strengthen health security. To the countries with lower vaccine coverage, the world stands ready to support you. This summit should make that clear if it wasn't clear before. Where you show leadership and political will, the global community will work to provide necessary doses and the support to get those doses into arms. The commitments announced here today will provide new momentum to help you accelerate your campaigns. And together, we can honor the lives of the millions we've already lost by doing all we can to protect those still at risk. Thank you so much.
Thank you. Let me thank all of our three co-hosts for your words. And if I take away the one theme, now is not the time to back down. Now is the time to double down and get as many people as possible vaccinated. Let me now turn to our panel and begin with the first panelist, the Distinguished Minister of Health from Nigeria, Dr. Osaji Henari. You have the floor.
Thank you, Ms. Rita Roy. Your Excellencies, Minister colleagues, ambassadors, ladies and gentlemen, I'm delighted and honored to address the second Global COVID-19 Summit and add Nigeria's voice to that of world leaders committed to ending the COVID-19 pandemic, bold, measurable, impactful actions, which also prepare us to face future public health challenges. I thank the United States government for hosting this summit. Following the first summit in September last year, our Presidential Steering Committee on COVID-19 organized a national summit to analyze strengths, weaknesses, and opportunities of our response and identify steps and performance milestones to measure progress towards ending the pandemic. That helped us to chart the way forward. Nigeria is committed to leveraging efficiencies in surveillance, supply chain management, and service delivery to integrate COVID-19 vaccination into routine immunization and other disease prevention and control programs, and ensure wide coverage. To accelerate demand and uptake, Nigeria engages local stakeholders to address vaccine hesitancy and misinformation. We targeted 112 million adults for COVID-19 vaccination, 70% of which we plan to reach by the end of this year in our renewed effort to get shots into arms. We also expanded access to COVID-19 testing and prompt treatment with many more laboratories, dedicated intensive care units and treatment centers, and awareness creation to reduce transmission with a focus on high-risk persons. Integration of this strategy into existing service delivery at primary health care and community level is a priority, as is routine data entry into our integrated disease surveillance and reporting platform. Implementation of this strategy in our primary healthcare centers would be optimal if they were all functional. Nigeria desires support to address the deficit and revitalize 2/3 of primary healthcare inventory and ensure the ideal capacity to address both public health security deficits and health services with infrastructure and human resources for health system strengthening, and for universal health coverage. Nigeria commits to training an additional 10,000 frontline healthcare workers by December 2022 on infection prevention and control measures, and to ensuring medical oxygen sufficiency nationwide and adequate stock of personal protective equipment and other COVID-19 tools by improving the supply chain system. Nigeria has strengthened her laboratory capacity and is engaged in genomic sequencing and biobanking for diagnostic and surveillance purposes. As we learn more on the frontiers for pandemic control, Nigeria commits to updating all 2020 COVID-19 country documents in accordance with the WHO guidelines and to structuring governance and leadership in collaboration with the international community and development partners. We shall be progressively increasing domestic health budgets to build a robust and resilient health system. Nigeria will develop an evidence-based national health security framework, and to this end, develop corporate social responsibility guidelines to engage the private sector and to make public health security a shared responsibility while promoting their businesses. Finally, Nigeria commits to collaborating with international bodies in research and development to improve capacity to implement initiatives that add to the body of knowledge on COVID-19, including the development of new vaccines and decentralization of production capacity. I therefore call on political leaders worldwide to increase efforts to end the COVID-19 pandemic by the end of this year and to jointly commit to building stronger health security for all of mankind. Thank you for your attention.
Thank you, Minister, and thank you for underscoring the importance of collaboration, particularly with civil society organizations. We will hear more about that work on the ground with our next panelists. Let me call on Dr. Tunji Funjo, who has long been involved in such vaccination efforts with the Rotarian International. You have the floor, sir. Dr. Tunjifunja, thank you.
For more than 30 years, just a little technical problem. Thank you very much for that kind introduction. For more than 30 years, Rotary Club members have led the drive to eradicate polio, a disease that once eliminated will be the second in the history of mankind. This effort has taken countless volunteer hours, billions of dollars and immunizations, and we believe the end is now firmly in sight. Less than 2 years ago, our efforts resulted in the certification of Nigeria and therefore the entire continent of Africa as wild polio virus free. This was no easy task. It was achieved by working with governments, leaders, and local health officials to encourage the nation and dispel misinformation. So how did we take the lessons we have learned and apply them to the global COVID response? Our local Rotary clubs can conduct social mobilization to communicate the benefits of immunization, and our person-to-person and door-to-door strategies can achieve extraordinary results when it comes to vaccine hesitancy. We are currently applying these same tactics to Rotary's COVID response in Nigeria and other African countries. Our polio national immunization days protect hundreds of millions of children from polio. And Rotary Family Health Days provide free health services to millions of people throughout Africa and South Asia. Rotary Family Health Days work with government health ministries to mobilize entire countries, not only to vaccinate, but to provide basic health care and services that save and transform lives. Through our work, we have immunized over 3 billion children against polio and supported the development of global immunization infrastructure. As the Global Polio Eradication Initiative community arm, our 1.4 million members have reach and access unlike any organization in the world. Immunizing the world against COVID-19 requires this same kind of sustained effort. To succeed, we need a community-by-community effort that focuses on vaccine equity. Rotary has kept its commitment to eradicating polio, and the world is now on the brink of this historic accomplishment. We are positioned and ready to join in partnership with others to bring these resources and talents to vaccinate the world against COVID-19. Thank you.
Thank you very much, and congratulations on all of the work and that tremendous track record on eradicating polio. And thank you for extending that infrastructure for the fight against COVID-19. Let me now turn to Dr. Richard Hatcheter of CEPI and provide him the floor. Thank you.
Ms. Roy, thank you for the introduction, and thanks to you and the co-chairs for convening this session and to the countries hosting today's summit. We are all painfully aware of the challenges we face in many countries in delivering vaccine to the populations that need and want to be vaccinated. We are also aware that the SARS-CoV-2 virus continues to evolve even as we speak. We do not know what is coming next. We do not know if or when we will face a new COVID variant or the next disease X. The reemergence of Ebola in the Democratic Republic of the Congo and the recent unexplained cases of hepatitis in children around the world should remind us how quickly new infectious diseases can strike. CEPI has proposed, and in 2021, the G7 and G20 embraced the idea that the world must be able to deliver vaccines for use against any new threat in 100 days. But delivering authorized vaccines in 100 days is only part of the equation. If the production of those vaccines cannot be scaled or is restricted to a few sites, we will almost certainly have outcomes like the ones we have experienced during this pandemic. Dozens of new manufacturing initiatives have emerged over the last 2 years to remedy this problem. These include the construction of new or expanded plants, investments by development finance institutions, technology transfer initiatives, and the establishment of regional partnerships, training hubs, and task forces. This is encouraging, but these investments aren't adequately coordinated. There has been no assessment across the totality of global or regional investments, nor is there a mechanism to ensure that these investments will be viable or that emerging needs are identified quickly and addressed. We need a more cohesive roadmap if we are to achieve the dynamic state of readiness that is required to meet future threats. A properly designed roadmap would set shared goals and principles with an underpinning regional architecture, develop better visibility and forecasting of manufacturing capacity and supply chain requirements, establish pre-positioned day zero financing that can jumpstart research and development in global manufacturing efforts and assure research and development investments facilitate global access and distributed manufacturing. Such a roadmap could also help sustain production capacity in the inter-pandemic period, expand regulatory capacity and harmonization processes toward greater convergence and alignment, and adapt the model of Operation Warp Speed in the US and the UK's Vaccine Task Force to develop governance processes enabling a mission control approach to implementation for the world. A last reflection. The last mile struggles we are having now in reaching those who need vaccination most derives from the fact that we are asking many countries to reach segments of the population they have never tried to vaccinate before. We must continue our efforts resolutely, but let us also make sure our work now lays the foundations of enduring adult vaccination programs so that next time we don't face the same hurdles. Expanding adult vaccination programs around the world will save lives, improve the quality of life for millions, enhance the ability of countries to respond to future threats, create demand for vaccine, and thereby help sustain the expanded global manufacturing capacity that we need. Thank you.
Dr. Hatch, thank you so much for your leadership and for CEPI's leadership to put in place the measures required for to prepare for future threats, as well as to secure our global health security. Thank you so much. Let me now turn to the Honorable Minister of Foreign Affairs from Pakistan, Minister Billawal Bhutto Zardari.
Thank you. Excellencies, ladies and gentlemen, it is my privilege to address this important global COVID summit today. I am indeed grateful to Belize, Germany, Indonesia, Senegal, and the United States for inviting Pakistan to this August gathering. The COVID pandemic upended our societies. Millions of precious lives have been lost. Countless livelihoods were disrupted. It is a somber time for human civilization, a period to reflect on what truly matters. With this realization, we fought this pandemic together with varying degrees of success. 26 months since the onset of this pandemic, we are now well positioned to draw lessons from the adequacy of global and national responses to this unparalleled health emergency, and lessons we must draw to discuss and develop short and long-term solutions to this, as well as future health crises. Firstly, any approach to deal with health crises must be grounded firmly in scientific evidence and logic. Responses, monitoring, and evaluation should be guided by established methods of epidemiology and community medicine. Pakistan's response saw positive results despite our limited resources and capacity. We locked down very quickly, allowing our provincial and federal governments the space and time to set up the necessary infrastructure to combat this pandemic. We prioritized practical containment, limited geographical specific lockdowns, vaccines, and boosters. And we shall continue to adopt standardized tools for enhanced access to new tests and treatments. Secondly, our responses must be customized to fit the specific and peculiar needs of our societies. Every country and region will have to devise its own strategies. One-size-fits-all approaches cannot be used to battle such pandemics. By way of example, China's zero COVID approach, rooted in China's realities, was particularly successful in eliminating the virus, saving countless lives and swift economic recovery. Thirdly, international cooperation and coordination is of fundamental importance to the success of national efforts. Health security, especially in the times of pandemic, is indivisible. Microorganisms, viruses, bacteria do not recognize nation states. For them, we are all the same. To counter them, we must act as one. I must acknowledge here the support we received from a number of countries and international organizations. The United States was immensely generous in providing 62 million vaccines to Pakistan. And in addition to this, we appreciate your commitment to providing 64 million pediatric vaccines, in addition to what we have already received. And of course, China from the outset supported us tremendously. Pakistan too provided COVID-related assistance to countries that needed it. In this context, it is also important to develop synergies with specialized agencies such as the WHO, UNICEF, and COVAX. Pakistan will continue to work closely with them to bolster our national response. We also intend to scale up our capacities as one of the WHO spokes for mRNA technology and help expand vaccine supply to EMRO regions and beyond. Fourthly, the humanitarian principles must form the backbone of national and international responses to global pandemics. In such situations, we believe a state needs to take care of its citizens like a mother cares for her child. I must salute all those doctors, healthcare workers, frontline workers who went beyond the call of their duty to help their fellow citizens in this time of need. Many of them lost their own lives. Their spirit must serve as a beacon for national efforts. And finally, some lessons on what we must not do. Finger pointing, politicking, both at the national and international level, profiteering and rumor mongering, especially when it relates to undermining the scientific evidence and hard data. I would like to end by emphasizing that the fight against COVID must promote international solidarity. It has been evidently clear in the last 2 years that our survival hinges on our ability to work together. Platforms like these should help forge greater unity among humanity so that the battle against this menace can be won decisively. Thank you very much.
Thank you, Minister, and thank you for reinforcing the point that science and good public health practices need to prevail. Thank you as well for mentioning that we need to meet the needs of countries where they are, and yet at the same time call on for international unity. Let me turn now to the Honorable Minister of Health of Tanzania, Her Excellency Umi Ali Mwalimu.
Thank you very much. Thank you very much, Your Excellencies, Honorable Ministers, distinguished participants, ladies and gentlemen. Greetings from the United Republic of Tanzania. It is an honor for me to speak in this visual second session of the second Global COVID-19 Summit, representing Her Excellency Samia Suluhu Hassan, the President of the United Republic of Tanzania. President Samia is wishing us a productive summit that will pave a way to end COVID-19 as a pandemic and prepare for the potential global health threats in the future. Excellencies, ladies and gentlemen, at the outset, let me take this opportunity to thank the governments of Belize, Germany, Indonesia, Senegal, and the United States of America for organizing and hosting this important event that provides us with an opportunity to redouble our joint efforts to eliminate the acute phase of the COVID-19 pandemic and get prepared for future health threats. The government of the United Republic of Tanzania would like to assure the global community its political will at augmenting efforts to control COVID-19 with an emphasis on getting vaccines to those at highest risk. Ladies and gentlemen, on COVID-19 vaccination, it was officially launched in Tanzania by Her Excellency President Samia Suluhu Hassan, July 2021. The vaccination targeted the most vulnerable populations in the country, which included frontline healthcare workers, people with comorbidities, adults 45 years and above, and frontline essential workers. The estimated priority target population for COVID-19 vaccination in Tanzania is 30.7 million. Since the introduction of the vaccine, we received about 11.2 million doses from COVAX facility and from bilateral donations. As of 9th May 2022, a total 7.7 doses have been administered in Tanzania. On the same date, a total of 4.4 million people, which is about 13.3% of the targeted population, were fully vaccinated. Ladies and gentlemen, while we acknowledge the support of the COVAX initiative and those of other bilateral and multilateral agencies, we would like to underscore that many countries in the African continent have continued to face uncertainties in vaccine access and availability. Vaccine equity cannot be guaranteed by goodwill alone without expanding production capacity. And this has been also highlighted by previous speakers. Therefore, we urge the international community to support initiatives for building vaccine manufacturing capacity in African countries. Ladies and gentlemen, in order to accelerate vaccine coverage for vulnerable populations in Tanzania, the government of Tanzania is committed to do the following. First, strengthen coordination through technical and high-level dialogue with multilateral and bilateral organizations, including multinational banks, WHO, Gavi, COVAX, and other COVID-19 vaccine delivery partnerships. Engagement of policy, community leaders, and key influencers using multiple platforms to support accelerated plan for COVID-19 response, including addressing vaccine hesitancy and enhancing acceptance at community level. We are also committing to integrating COVID-19 vaccine and interventions with other health interventions such as HIV, malaria, and RCH in delivery of the COVID-19 vaccine. We do also commit to strengthen the capacity of health system by equipping healthcare staff with knowledge and skills in prevention, early detection, and timely response of public health emergencies. construction and rehabilitation of health facilities to support essential healthcare, which was affected by COVID-19 pandemic, especially to primary healthcare. We do also commit to recruit and train human resource to support COVID-19 and other essential health services. Of course, we are also committed to strengthening emergency care, such as construction and installation of oxygen plants, X-ray, emergency medical department, and intensive care unit equipment to support primary healthcare services. Ladies and gentlemen, before concluding my remarks, I would like once again to thank the government of Belize, Germany, Indonesia, Senegal, and the United States of America for hosting such an imperative summit, which will bring all nations together to get prepared and respond collectively to future global health threats. I would like to assure you all that the government of Tanzania will continue to cooperate with you to ensure an enabling environment for vulnerable populations to access vaccine without any barriers. Thank you very much for listening.
Thank you, Minister, for reinforcing and reinstating your government's commitment to vaccinating your population as well as working with us. I think we're very inspired by the fact that you're using this opportunity to strengthen your own healthcare infrastructure. Now let me turn to Dr. Seth Berkley, Gavi, the Vaccine Alliance, to speak about their efforts, not only to ensure vaccine supply, but to ensure vaccines become vaccinations for the most vulnerable. Seth, over to you.
Thank you, Rita. Thank you, President Biden and your co-host for convening this very important summit. Your leadership and support has helped COVAX to protect hundreds of millions of the most vulnerable people and ensure we're ready for future pandemic shocks. So far, COVAX has delivered nearly 1.5 billion doses of vaccine. The vast majority, more than 1.3 billion, have gone to people in the 92 lower income countries that otherwise would have struggled to get them. Now we're entering a new phase of the pandemic. For the first time since it began, supply now exceeds demand. This brings into sharper focus, arguably one of the toughest challenges, turning vaccines into vaccinations for billions of people, particularly those most at risk in some of the most resource-poor and difficult-to-reach places in the world. In many wealthy countries where coverage is high, life is beginning to return to normal, even when cases are again on the rise. But in low-income countries, it's a very different story. Despite huge progress, with an average coverage of 46% with 2 doses, many lower-income countries, 18 at the last count, have still yet to protect 10% of their population with 2 doses. These aren't just the last people to be reached, they're some of the hardest to reach, and in terms of future pandemic preparedness, one of our biggest blind spots. That is why COVAX is accelerating its country-centric approach to support countries with low coverage. Thanks to the ongoing support of the international community last month at the Gavi COVAX AMC Summit, we have made important progress not only towards ending this pandemic, but preparing for the next one too. And we're encouraged by the continuing commitments made through this important summit. This, together with the Vaccine Delivery Partnership, will help countries scale up their delivery systems, increase their absorptive capacity and demand, and provide support to cover ancillary costs for the donated doses, so we can get the right vaccines in the right volumes at the right time to those who need them. However, we can only do this if the supply of vaccines continues to flow. That is why COVAX recently launched its pandemic vaccine pool to future-proof its supply. This will ensure that if the need arises for additional coverage, boosters, or perhaps new variant-specific vaccines, that we are ready and can continue to provide countries with the doses they need. Of course, we also need to build a more distributed manufacturing of vaccine supply in all regions, as several distinguished speakers have mentioned. Gavi has a role to play here, as we have ever since we were established in 2000, working closely with donors, manufacturers, and other partners to shape and expand healthy vaccine markets. by ensuring we are prepared for whatever else this pandemic throws at us. It serves as a model for how we can act much more rapidly in response to future pandemics. We now call on others to make commitments and reinforce their political will to stay focused on ending this crisis and to build better health security for the next health crisis, particularly for the most vulnerable. Because if we're not prepared to protect people in all corners of the world, then we're not really prepared at all. Thank you so much.
Thank you, Seth. Thank you for all of the efforts that Gavi is leading on and for really ensuring vaccine preparedness for the future. Now let me turn to our last panelist, His Excellency Billawal Gafar, the Minister of Health of Palawan.
Thank you so much, Ms. Roy. Greetings to co-hosts, Your Excellencies, distinguished panel members, and ladies and gentlemen. It is indeed an honor and a pleasure for Palau to be part of this distinguished panel and, of course, this very critical convening for COVID-19 global convening. Palau, despite our remoteness and our geographical isolation here in the Pacific, we have not been spared, much like other Pacific jurisdictions. We have not been spared by COVID-19. And it is only in the past 4 months that we've gone through what everybody else in the world had 2 years to go through. We had our first cases in December 2021. And since then, we've had our own, our initial surge of COVID-19. However, we have had some tremendous success with mass vaccination of COVID-19. And to date, since we started vaccination 16 months ago, today we've vaccinated at least 98% of the total population fully vaccinated and around 60% with one booster. And that was really due to several key factors. The first of which, of course, is the support we have been receiving from international bilateral partners such as the United States, WHO, and of course, the Vaccine Alliance for COVID-19 vaccines. And we were the first among the jurisdictions in the Pacific to receive and start administering COVID-19 mRNA vaccines back in January 2021. The second key factor for our success is really having the partnership and the buy-in from leadership here in Palau at all levels, from the national government to the state government, local governments, and of course, buy-in from the most important people, which is the community members that we're trying to vaccinate. The third key factor is really clear, consistent, and credible communication with the community and stakeholders, especially civil society partners and, of course, the media play an important role in ensuring that our efforts are achieved. The fourth is the commitment, the passion, and the effort of our healthcare workers and our frontliners, really driving the vaccination efforts and ensuring that the community is receiving the vaccines they need. And so moving forward, like many other places, our main challenge now is really trying to maintain a balance between sustaining a robust and effective response to the ongoing pandemic and all of its developments. And this, of course, includes ensuring that vaccination continues, that access is available to those most vulnerable, the immunocompromised, and those that are geographically isolated. It includes balancing between the response as well as existing services that might have been neglected over the past 2 years, especially with non-communicable diseases, which remain the top leading causes of death in Palau rather than COVID. And so our commitment, not just locally, but regionally, is really to ensure that this balance is maintained while ensuring that vaccination is ongoing. COVID-19 vaccination is ongoing. The other thing is we need to be more committed to our healthcare workers. We've lost so many in the past 2 years. And so we need to remind ourselves that we too are vulnerable to the pandemic. And so we must ensure that our own people, our own healthcare workers are taken care of. And last but not least is to ensure that the social programs remain in effect and enhanced to ensure that the community is taken care of from the indirect effects of COVID-19. And so, with this, it's imperative that we remain hopeful and optimistic, but to also remain vigilant and resilient against the pandemic and the developments and the ongoing threats, and just ensuring that vaccination is ongoing and that we maintain proactive and effective preventive measures, which should allow us to move on, not from COVID, but with COVID. Thank you so much.
Thank you, Minister. Outstanding progress, and indeed it's a note and for hopefulness and optimism, and yet you so beautifully situated this milestone within the context of remaining vigilant, as well as staying close to your communities and keeping them informed and keeping them engaged, which is one of the reasons I'm sure why you've achieved such a high vaccination rate. This concludes our panel, and let me start to wrap up and first start by thanking everyone who's been part of this panel for joining us and for sharing your reflections. You've really shared about not only your pledges and your commitments, but what you're already doing and where you see the challenges and the solutions around those challenges. I think we can take from this panel the importance of remaining united, making sure that we are following good public health practices and being led by science, and that we need to make 2022 the year of delivery, getting vaccines into arms and turning them into vaccinations, particularly for those who are most vulnerable. So I thank all of you. Thank you for your attention and thank you for your commitment. And this brings our panel to a close. Thank you.
The UK joins the US and our other international partners in reaffirming our support for the global response to COVID-19 and renewing our commitment to ending the acute phase of the pandemic in vulnerable countries, as we agreed under the UK G7 presidency last year. And I want to thank President Biden for convening us. We know that this pandemic remains far from over. No one is truly safe until we're all safe. And that's why, since December, the United Kingdom has committed an extra £265 million to expanding testing capacity globally, boosting oxygen supplies, and investing in the next generation of vaccines. In total, the UK has committed £2.1 billion since 2020 to help end the pandemic and manage its impacts. We've donated over 60 million vaccine doses, which filled urgent gaps while global vaccine manufacturing increased. But we need continued innovation to go with that money too. So that's why the UK hosted the Global Pandemic Preparedness Summit this year, which raised over £1.2 billion for the Coalition for Epidemic Preparedness Innovation to help reach its goal to develop vaccines against new threats in 100 days. And it will also mean increasing finance for pandemic preparedness. And we welcome the US leadership in proposing a new financial intermediary fund so the world can invest more in preparing for future outbreaks, including by strengthening things like surveillance and national health systems. We still have a huge task ahead of us, so again I want to thank President Biden for bringing us all together. The UK stands with you as we end the acute phase of the pandemic and build better health security ahead of the next health crisis.
Excellencies, I want to thank the government of the United States for convening this critical summit. Today, even as attention fades, this pandemic is not over. Even as many countries ease restrictions, the virus threatens the unvaccinated. And make no mistake, even as children have been less affected by the virus itself, the impact of the pandemic on their lives and futures is profound. Since the start of the pandemic, 100 million more children have been plunged into poverty. Millions of children are missing out on routine immunizations against other life-threatening diseases, and millions of children's education has been disrupted. These children cannot afford for us to be anything less than completely committed to containing and ending this pandemic. Working together, we have secured a sufficient supply of effective vaccines. Today, the challenge is to turn those vaccines into vaccinations. UNICEF is proud to have spearheaded the work of the COVID-19 Vaccine Delivery Partnership, but we have to finish the job. That means supporting country-led efforts to accelerate progress. Many low-coverage countries have competing health emergencies and other urgent priorities. If we want to get shots into arms, we need to support these countries' efforts to tailor vaccination and COVID-19 containment strategies to their specific situations. That includes increasing support for community engagement, especially as people's risk perception of the virus wanes. Just as important, we need to strengthen community-based primary health care. Primary health care is the most effective way to deliver all essential health services, whether that's COVID-19 vaccines, routine childhood immunizations, or other services. It's also the first line of defense against future pandemics, helping us flag new variants and viruses and stem the spread of disease before it becomes a pandemic. And it can help build trust, in turn increasing cooperation with public health measures. We've come a long way together since the pandemic began. We need that same solidarity now. The commitments we make today will help decide when the pandemic ends and how it ends. Let's make sure it's not a legacy of disruption and disparity, but a moment of catalytic change to end this pandemic and build stronger health systems for everyone, everywhere.
Hello, I am Mauli Sabla, Catholic Relief Services Regional Technical Advisor for Health for the West Africa region. Today, I am proud to share CRS commitment to push towards global vaccination goals while addressing the long-lasting economic and social impact of COVID-19. To vaccinate the world, CRS will increase coverage by directly supporting COVID-19 vaccinations in 22 countries and mobilizing at-risk populations in over 100 countries. We will work with local partners, donors, the Catholic Church, and peer organizations to ensure the global response is robustly funded, equitable, and holistic. To save lives, CRS will leverage its network of over 1,500 partners to engage communities and health systems to reduce COVID-19 transmissions, illness, and death. A wide range of programs will address the devastating secondary impact of the pandemic, from education disruption to increased hunger to the loss of caregivers for nearly 8 million children. Finally, to build better health security, CRS will finance and fill gaps in health systems. We will continue to strengthen the resilience of faith-based health providers and public health systems. To realize these commitments, CRS complements public fund with $14 million in private and foundation funding disbursed to local partners through a rapid response fund. Catholic Relief Services holds fast to our Catholic values of solidarity and the preferential option for the poor and vulnerable. We are eager to work alongside the global community towards a future in which everyone is safe from the COVID impact. Thank you.
When scientists first sequenced the SARS-CoV-2 virus in 2020 and rapidly moved to develop effective vaccines, they weren't starting from scratch. Far from it. Their success relied on decades of investment in scientific advances and building from each other's innovations. Sustained investment of both time and money and unwavering commitment to the hard work of collaboration was the only way COVID-19 vaccines were developed. Now, to curb this pandemic and halt a resurgence in other deadly vaccine-preventable diseases, this same unwavering commitment to listen to, support, and collaborate with communities is the only way we are going to vaccinate the world. COVID is likely to disrupt our lives and livelihoods for years to come, so it's critical for vaccine delivery funding to empower professionals closest to community impact. We have all applauded health workers, but to truly support them, Congress must fund the U.S. Global Vax Initiative, Global Health Worker Initiative, and other critical programs. The G7 countries should act on the advice of their own task force and collectively provide $2 to $3 billion in new annual ODA funding for resilient health systems and their main ingredient, health workers. At Sabin, we're putting our global immunization program behind those professionals closest to communities, providing $9 million this year to bolster collaboration and capacity among more than 3,000 immunization professionals, researchers, health workers, and journalists. We are working to eliminate barriers to vaccine delivery, acceptance, and demand,
and to develop new vaccines to prevent future pandemics and better apply epidemiology to maximize the impact of vaccine rollout. We have already lost more than 15 million people in this pandemic. Let's put in the time and money to stop millions more from dying.
Please welcome Bill Rodriguez.
Your Excellencies, honorable ministers, distinguished panelists and guests, welcome to today's third session. My name is Bill Rodriguez, the CEO of FIND, and it's my privilege to be moderating this session, which is entitled Saving Lives Now, Expanding Access to Tests and Treatments. Our panelists today will discuss this critical issue, which is what can we do now to ensure that the existing tests and the new effective treatments are made widely available and widely used equitably on a global basis. As President Biden noted in his opening remarks, this pandemic has already exacted an enormous global toll. And yet fatigue has set in. Many countries have eased restrictions. Testing rates have plummeted globally by as much as 90% in some settings since January of this year. In many areas of the world, this dangerous mix of low testing rates, stagnating vaccination rates, close, large gatherings is the perfect setup for a new surge in global cases and the emergence of potentially more lethal new variants. Not testing means not sequencing, means we lose our ability to monitor these new variants as they emerge, and we have to play catch up and respond late to the emergence of these variants across the globe. Not testing means the treatments that so many have worked so hard to develop will sit unused nearby on shelves rather than saving lives. Not testing is ultimately a decision to close our eyes to the reality that the pandemic is not over, craving a return to a pre-pandemic normalcy rather than acknowledging that the virus may have other plans. So not testing means not monitoring, means not treating, means moving from preparedness and response to unpreparedness and no response. We heard from many heads of state in today's first session their renewed commitment to addressing today what needs to happen to end the acute phase of the pandemic and moving to a response to COVID over the longer term. We also heard Joy Fumafi from Chai announce a historic new pricing agreement for generic COVID treatments. Today, our panelists will cover all of these issues and address this critical issue of what can we do to save lives now by expanding access to tests and treatments on a global basis. To start us off, it's my pleasure to introduce our three co-hosts of today's session. Secretary of Health and Human Services, Xavier Becerra from the United States, Minister of Health and Wellness, Kevin Bernard of Belize, and Minister for Development, Svenja Schultz of Germany. We'll start with Secretary Becerra. Mr. Secretary, the floor is yours.
Bill, thank you very much, and thank you to President Biden and our summit co-hosts, Belize, Germany, Indonesia, and Senegal. And in particular, let me also thank my co-hosts for this critical session, Ministers Bernard and Schultz. As we heard in the previous session, vaccination remains a critical tool in the fight against COVID. And I'm pleased to confirm that the United States, through the Centers for Disease Control and Prevention, is providing an additional $15 million to the U.S. Global Vaccination Initiative, GlobalVax. This is a down payment on getting shots into arms, and we are determined to continue this important work. And as President Biden announced, NIH has licensed 11 COVID-19 technologies to the medicines patent pool under the WHO COVID-19 Technology Access Pool. And we hope that more patent right holders will contribute to this initiative. While expanding our vaccination efforts is vital, to your point, Bill, we need to focus on expanding global access to testing and treatment. Testing remains critical for tracking the pandemic, including for identifying new variants. But it's also critical for diagnosis, so that people can be linked to needed care, including new life-saving treatments that are becoming available now. The United States recently took steps to make treatments even easier to access in our country and to make sure healthcare providers and patients know about their safety, efficacy, and availability. We launched a nationwide Test to Treat initiative in March that gives people an opportunity to rapidly access free treatments at thousands of clinics and health facilities. We're nearly doubling the number of places that COVID-19 oral antiviral treatments are available in the coming weeks. We're supporting medical providers with more guidance and tools to understand and prescribe treatments, and we continue to educate people about safety and efficacy. As a result of these and other actions, the rate of people taking oral antivirals has more than doubled over the last several weeks. We also continue to focus on tackling disparities in access to care, and we want to work with all our partners to facilitate access to COVID-19 products for the hardest hit places and the highest risk people everywhere around the world. The U.S. Food and Drug Administration is committed to doing its part. Under existing U.S. law, FDA can review generic drug applications seeking tentative approval of a COVID-19 therapeutic. And FDA prioritizes the review of certain generic applications, including applications from the President's Emergency Plan for AIDS Relief, PEPFAR, and applications for products that help access public health emergencies, which would include generic versions of approved COVID-19 therapeutics. I'm also very hopeful about the work that the United States Agency for International Development will be starting in partnership with Global Fund, with UNITAID and others to scale up testing and treatment in up to 8 countries worldwide, as well as the Clinton Health Access Initiative's announcement of their work to expand access. The U.S. government is committed to working with all of you on this important issue, and I look forward to continuing this critical dialogue through my office and our teams at the Department of Health and Human Services here in the United States. Let us continue the work. Thank you very much.
Thank you very much, Secretary Becerra. I'd like to now introduce the second co-host for this session, the Minister of Health and Wellness of Belize, Kevin Bernard. Your Excellency, you have the floor.
Thank you, Bill. It is a pleasure for me to be co-hosting this session with the distinguished Development Minister of Germany, His Excellency Scholz. I must acknowledge and commend Germany for its leadership on the global response to the COVID-19 pandemic, and particularly its successful hosting of the recent Gavi-COVAX AMC Summit. Excellencies, testing and treatments are critical components to ending the acute phase of the pandemic. Yet, the current state of testing and accessibility of treatment is cause of serious concern. Globally, testing rates have been declining. According to ACTA, low and low middle income countries account for only 20% of testing globally, even though we account for over half of the global population. Even in Belize, average daily testing in the last month is barely a third of the rate of testing in January. Regrettably and inadvertently, countries have shifted focus to administration of vaccines. But we cannot forget that sufficient testing is critical to understanding the course of infections and guiding the requisite policy and public health interventions. Cost of testing, not just of materials and supplies, but also to maintain accessibility and the deployment of the requisite frontline personnel are major challenges for low and low middle income countries like these. In this regard, international cooperation and support is indispensable and needs to be sustained to ensure that our countries are able to maintain adequate level of testing. Similarly, genetic sequencing is necessary to detecting, tracking, and responding to new COVID variants. This is essential for health policymakers to have a real-time picture of the evolution of COVID-19 virus within our societies. With support from the US government and its Center for Disease Control, Belize has received genomic sequencing equipment to detect COVID-19 variants, as well as the related training for our laboratory technicians. In so doing, we are developing local capacity to analyze virus samples as they appear in country. The Caribbean has taken a regional approach to its response to COVID-19, which I believe is a model. The Caribbean Public Health Agency, CARPHA, has been instrumental in testing and genetic sequencing of samples for CARICOM member states. With support from the World Bank, CARPHA only a few months ago acquired the capacity to complete genome testing, a service which is now at the disposal of CARICOM member states. Testing complements the appropriate administration of treatments. To be effective, treatment should begin within a few days of symptoms. Therefore, testing infrastructure must be in place to play its supportive role. However, incomprehensibly, treatments are still not widely available in the Caribbean or elsewhere in low and middle income countries. Current projections indicate that treatments will not be available for developing countries until about mid-2023. High-income countries have bought almost all existing supplies. The early challenges we encountered in accessing vaccines, including financing and patent hurdles, are replaying all over again. Treatments save lives, offer additional protection for frontline and high-risk persons. Treatments reduce deaths and hospitalizations by as much as 90%, thereby easing the strain on the health system. Treatments can also save lives in places where vaccine uptake has been uneven. Excellencies, our small island developing states in the Caribbean do not have the domestic financing to compete with high-income countries in purchasing the antiviral treatments. For us, multilateral support will be critical to accessing treatments and to eventually ending the acute phase of the pandemic. Therefore, it is important that multilateral institutions, WHO, UNICEF, and ACTA, are adequately funded. Even so, many of our Caribbean countries are classified as middle-income countries, despite our vulnerability, making us ineligible for donor-funded treatments. This unfortunate error and injustice needs to be corrected. We welcome the progress being made at the WTO on the waiver of TRIPS, which would temporarily waive intellectual property protections of COVID-19 vaccines, treatments, and products. Those efforts need to be accelerated. We welcome the progress as well. And of course, in the course of the last 2 years, we have learned important lessons that are essential to ending the acute phase of the pandemic. These lessons, including the key role of multilateral institutions in coordination, the importance of adequate financing, in particular, to support the public health systems of vulnerable countries, and the moral imperative to ensure equity and access. The interconnectedness of today's world means that the acute phase of the pandemic cannot be reached in a few countries or in a particular region alone. It has to be worldwide. We can only achieve this together. Thank you.
Thank you, Minister Bernard, for highlighting many of the challenges we face as a global community. It's now my pleasure to introduce our third co-host for this session, Minister for Development, Svenja Schulze of Germany. Minister Schulze, the floor is yours.
Thank you very much. Excellencies, colleagues, ladies and gentlemen. We all know that to successfully combat the COVID-19 pandemic, the international community needs to use all the tools at its disposal. And in addition to rolling out vaccinations, we also need to ensure equitable access to testing and therapeutic options to minimize infections, hospitalization, cases of severe illness, and long COVID. And this is particularly important to protect the most at risk and the vulnerable groups. So Germany believes that testing and treatment strategies have to go hand in hand and out of the total 1.2 billion US dollars we have provided to Act A in 2022. 200 million US dollars is in support of the diagnostic and therapeutic pillars. And I am really pleased that Federal Chancellor Olaf Scholz announced earlier today that Germany will also contribute an initial 50 million euro to set up a new fund for pandemic preparedness at the World Bank. Unfortunately, testing rates are lower than ever, especially in the low income countries. We just heard that a minute before. And that means that we as an international community are flying blind through the pandemic. And to contain the pandemic, affordable or free tests need to be available to all people everywhere. Moreover, testing strategies have to be shifted towards decentralized, community-based testing, and people in low-income countries should have access to self-testing and more guidance on how to use those tests too. Test results from all countries need to be better integrated into reporting channels to improve global surveillance. And genomic sequencing should be intensified to detect new variants. And we need to promote transparency and the voluntary sharing of data on COVID-19, not penalize countries that report new variants. Global access to COVID-19 treatments is a humanitarian imperative, and the WHO has recently recommended new oral antiviral pills to procure them. Act A will need more than $1 billion US dollars. As their supply will be limited at first, we need to appropriately prioritize their distribution and ensure that they are effectively used. And in addition, Act A needs another $1 billion US dollars to supply oxygen for critically ill patients. And last but not least, it is important to build up sustainable local medical supply chains, not only for vaccines, but also for diagnostic, therapeutics, and personal protective equipment. So to conclude, Germany has provided its fair share and remains committed to ensuring balanced financing of all Act A pillars. And I call on all other donors to do so too. Joining forces through Act A will help to strengthen health systems and bolster pandemic prevention and preparedness, saving lives and benefiting us all. Thank you.
Thank you, Minister Schulte. I'd now like to turn to our group of panelists and remind each of you to be succinct in your remarks. Our first panelist will be the Honorable Minister of Health for the Republic of Rwanda, Dr. Daniel Ngamije. Dr. Ngamije, Rwanda has made tremendous progress in vaccination rates, and in anticipation of the summit, has committed to vaccinating children, to doubling booster rates, and to investing in local manufacturing of vaccines. Moving to test and treat, Rwanda has been a global leader in test and treat programs over the past 2 decades for HIV. So I'm hoping in your remarks you can frame for us Rwanda's experience and how you see the rollout of test and treatment programs moving forward in Rwanda based on your experience. Your Excellency, you have the floor.
Thank you, Dr. Bill, the moderator. Excellencies, honorable ministers, I'm pleased to be invited to this summit and to share our experience regarding the increase of testing capabilities. For almost 2.5 years, COVID-19 pandemic taught us how a public health issue can have socioeconomic consequences, causing serious threat to the achievement of SDGs in general, and mainly all health-related SDGs goals in particular. In this fight, we all noted disparities in access to health products, such as diagnostics, therapeutics, vaccines, and other health commodities, despite shared and evidence-based conviction that we all need to be safe in order to stop this pandemic. In fact, as well said by Dr. Peter Piot, some epidemics on the other side of the world are a threat to all of us. I commend the results made by Access to COVID-19 Tools Accelerator, ACT, in terms of development, production, and equitable access to COVID-19 tests, treatments, and vaccine. Strengthening our health system is the key in order to end the current COVID-19 pandemic and to be adequately prepared to face emerging and re-emerging viral pandemic of similar magnitude. Real-time detection at all levels and timely management of cases are paramount. You can't control successfully a public health threat blindly. In Rwanda, we deliberately invested resources to increase and decentralize capacity diagnostic capabilities. COVID-19 PCR tests are now conducted in all hospitals, in addition to rapid tests performed in all health facilities. Genomic sequencing used different platforms, including NextSec platform, is now effective at the national level for genomic surveillance of variant of concern. Additional investment was made to increase 3 times oxygen production in health facilities, expand intensive care units in provincial hospital, construct national referral COVID-19 treatment center instead of using a district hospital as a treatment center. Finally, enhance the supply chain of drugs and commodities to prevent disruption of health services, even during the period of movement restriction due to COVID. It is important to highlight the impact of enhanced use of IT systems in recording and communicating timely test results, COVID-19 antibodies levels, vaccine status, etc. All this generated confidence in the health system, created the demand and overall acceptance of services by community in rural and urban areas. Regarding access to safe and efficient therapeutics, with the support of Rwanda Scientific Advisory Group, comprising members from WHO, CDC country office, we regularly reviewed and adjusted our COVID-19 clinical management guideline to include most of updated and effective therapeutics recommended to COVID-19 patients. For being able to manage even highly severe cases, most of expensive therapeutics like monoclonal antibodies were acquired and administered to more than 1,000 patients. Before receiving these life-saving antibodies, we also used therapeutics like tocilizumab, which was very effective against cytokine storm. All this was done to ensure effective continuum of care for severe cases transferred at the central level. Now, in terms of principles, we believe that expanding access to saving lives tools requires some reforms, innovation, critical intervention at national and global level in order to ensure global health equity. There is a need to fill gaps in primary health care with adequate domestic financing in addition to what partners can give to a country. We need also to set very functioning structures and required procedures to prevent, detect early, and manage holistically pandemics. We need to organize effective food procurement of critical commodities. We need to encourage transfer of knowledge, skills, and IP's special arrangements for manufacturing critical commodities and therapeutics in areas where high level of dependence is itself a global health security challenge. We commend BioNTech initiative in Rwanda and Senegal and Ghana, and we commend also European Union investment to support Rwanda FDA. Excellencies, honorable ministers, in 2021, COVID reminds us that there is a need of a transformative partnership among key pillars of the new public health order. Rwanda remains committed to work effectively with the rest of the global community in finding sustainable solutions and tools aiming to end the current pandemic and also be sufficiently well prepared for future pandemics. As I conclude my remarks, I wish to reiterate the equitable access to testing and therapeutics is not an act of charity, but a real milestone to achieve as part of global solidarity in order to assure global health security and other highly dependent global gains. I thank you.
Thank you, Dr. Ngamije. I appreciate that you highlighted the fact that ultimately pandemic preparedness is about strong primary healthcare systems and strong global supply chains that can reach everyone equitably. Our next panelist is Her Excellency Reem Ibrahim Al-Hashimi, Minister of State for International Cooperation, United Arab Emirates. Your Excellency, you have the floor.
Thank you very much, Bill, and great welcome to fellow colleagues, excellencies, ladies and gentlemen. I'm very pleased to be able to join you today, and many thanks to our hosts for bringing us all together. After over 2 years since the outbreak of COVID-19 and the continuous health and economic ramifications that has spread all around the world, we really do need to galvanize our own collective efforts as nations, but also as an international community to truly preserve a resilient, fair, and dignified global healthcare system. Our own journey here in the United Arab Emirates was centered around early intervention and scientific underpinnings, which is why we recognized at the onset that testing is a necessity, not only in detecting the disease, but also in sharing our findings and genetic sequencing on the evolution of the different variants with many friends and partners around the world. As we look to the future, we remain cautiously optimistic, because a foe of this magnitude demands that we must find an effective mechanism to work together quickly and holistically. In this spirit, we work closely to provide the support that we had here in the UAE with another 136 countries, comprising of medical supplies as well as fully equipped field hospitals to 9 countries. And as firm supporters of the COVAX facility with in-kind donations amounting to $50 million, our commitment to ensure universal access to vaccines is testament to this principled conviction. Alongside this, there are many other measures that must be undertaken and have been to varying degrees, including healthcare readiness, advanced technologies, effective communication, extensive contact tracing, and mass screening programs. Here, I'd like to underscore how important it is that we continue to advocate for scientific findings and battle vaccine misinformation that hinders all of our collective efforts. As a current member of the UN Security Council, the UAE will continue to deepen its commitment to improve cooperation on global health. It is with great pleasure, therefore, that we announce a contribution of $60 million, $10 million to be dispersed for the Access to COVID-19 Tools Accelerator, and $50 million as in-kind donations of medical supplies to that end. Thank you all very much for your time and attention.
Thank you very much, Your Excellency. Turning now to the regional response across the African continent, it's my pleasure to welcome Dr. Ahmed Ogwell Uma, who's the Deputy Director of Africa CDC. First, Dr. Uma, I want to thank you and the outgoing director, John Nkengasong, for the tremendous leadership that Africa CDC has demonstrated in the emergency response to COVID across the continent. And I'm looking forward, as we all are, to your remarks on how do we expand testing and treatment today to save lives, and how do we balance the urgent needs for the ongoing pandemic with the need to address ongoing needs across healthcare systems in the continent. Dr. Uma, the floor is yours.
Thank you very much, Bill. Excellencies, heads of states and government, excellencies, honorable ministers, distinguished heads of international organizations participating, distinguished heads and representatives of non-governmental organizations, fellow speakers, participants, ladies and gentlemen. Let me start by thanking the host countries led by President Biden for putting together this very important event and inviting us as Africa CDC to participate. We thank you, Bill, also for a very good moderation, and we are looking forward to some really engaging interventions from all those invited. The pandemic is still very alive here in Africa. We only have 16% of our population fully vaccinated, and yet we have a target of 70%. So as we talk about testing and treatment, we are very acutely aware here on the continent that we also need to focus on getting our people vaccinated. The global average today is 58%, and it shows you just how far distance we have to cover as Africa. Indeed, the COVID-19 virus is still very actively circulating on the continent. 12 of our countries have experienced a fifth wave, and one or two are even undergoing a sixth wave as we speak currently. So this pandemic is still very much alive on the continent. Since we documented our first case in February of 2020, Africa CDC and the Africa Union have launched and implemented over 12 different initiatives, all geared towards mitigating the effects of this pandemic. All of them have been implemented under the strong banner of solidarity of African Union member states, including effective use of public health measures, scaling up testing, ensuring access to treatment, and vaccination rollout across the continent. The two latest initiatives that we have gone into are the Saving Lives and Livelihoods program and the Bingwa initiative. Both of these are targeting increased vaccination across Africa, with the Bingwa initiative being specifically designed for the youth, seeing that Africa is largely a youthful continent. Reaching that target of 70% will require focus and sustained resources, particularly in this time when there is a feeling that the pandemic may be over. For us on the continent of Africa, it is not yet over. The focus of vaccination must now be how do we get the vaccines into people's arms, and rapidly so. Just as we chase the polio virus in every corner of the continent, so must we drive the COVID-19 pandemic into a space of safety, because we have vaccinated everybody that needs to be vaccinated. Your Excellencies, ladies and gentlemen, Africa's health security is critical to global health security. If COVID-19 remains a threat anywhere in this world, it will be a threat everywhere on the globe. So I invite you, all of you, to work with us to rapidly vaccinate 70% of Africa's population. And while at it, let us also work together to effectively prepare for the next pandemic by strengthening our institutions that are working in public health, by strengthening our health workforce, by building Africa's local manufacturing capacity for health products, by developing action-oriented partnerships based on Africa's priorities, and by improving domestic financing for health security on the continent. Let us work together to vaccinate 70% of Africa's population and lay a strong foundation to tackle the next pandemic effectively. I thank you all.
Thank you, Dr. Uma. Those points are well taken. Africa CDC has had a great responsibility in the past few years, and we are all grateful for how well and how successfully you've shouldered that responsibility. Next, as a founding partner of the ACT Accelerator, and with a relentless commitment to this pandemic and past and future pandemics, it's my pleasure to introduce Mr. Bill Gates, who's the co-chair of the Bill and Melinda Gates Foundation. Bill, the floor is yours.
Well, I'm grateful to the United States, Belize, Germany, Indonesia, and Senegal for bringing us together to discuss our progress on this critical issue. I'm excited that the Biden administration is making its best efforts to secure more funding for the global pandemic response. I hope Congress acts quickly on this. This pandemic isn't over. This point was made even clearer to me when I tested positive for COVID this week. We need to make more life-saving tools and allocate them based on need rather than wealth. This means getting COVID vaccines, boosters, and therapeutics to the people most at risk, no matter where they live. It's also clear that we need to think about readiness for future pandemics. We've learned a lot during this pandemic that will allow us to prevent this happening again. But we don't have time to waste. we need to get a plan and step up our commitments. The Gates Foundation is committing an additional $125 million to help end the pandemic and to take the first steps to prevent future pandemics. Our focus is on the countries most often left behind. We're supporting disease surveillance to ensure companies can rapidly identify threats. We're helping to accelerate R&D of better vaccines, better diagnostics, and better therapeutics, which will be more accessible. And we're learning about how we work with countries to manage COVID alongside their other health challenges. This commitment is in addition to our overall work and contributions for health equity and resilient health systems. I know that we can make great progress as we join together on this. We need to figure out how to have a dedicated core of experts around the world who are preparing for new threats and can mount a coordinated response. Just like we have firefighters who are always practicing on alert. We need to back this up with data systems about health and deaths overall. And so with integration, we can share and immediately see any elevations. We have to have very quick processes for all of the tools and get them out faster than we did with COVID. And we need to keep fighting other endemic infectious diseases and use these systems to help with emerging diseases as well. The world faces a lot of challenges, but I'm convinced we can address these health challenges. I'm convinced we can make remarkable progress. I'm encouraged by Indonesia and the G20's efforts to catalyze new pandemic funding. The G7, working with the African Union and other partners, can play a big role in ensuring international cooperation. I know we can equitably end this pandemic and prevent the next pandemic, making the world a safer, more equitable place by acting urgently. Thank you.
Thank you very much, Bill, for your ongoing and new commitments. And as someone recently recovered from a bout with COVID, I wish you a mild course and a speedy recovery. Next, I'd like to turn to Her Excellency Minister Tvinnereim of Norway. Norway has been at the forefront of the ACT Accelerator and in addressing health systems to both prepare for and respond to pandemics. Your Excellency, the floor is yours.
Thank you, Bill, and honorable colleagues, friends. First, let me thank Belize, Germany, Indonesia, Senegal, and the United States for hosting this summit. The pandemic is far from over, and up to now, most discussions have focused on the vaccines, the vaccinations, which remains a top priority. Yet, the access to testing and treatment is equally important. And unless COVID-19 cases are detected, they can't be isolated and effective treatment can't be provided. Now, COVID-19 is likely to stay with us also in the form of new variants, and we are adapting existing health systems to encompass COVID-19. At the same time, we must give priority to those at risk and to those with chronic diseases. Now, let me highlight 2 ways to ensure access to testing services, oral COVID-19 pills, and oxygen. First, we must fully fund the ACT Accelerator. Only 3% of the funding for the therapeutics pillar has been provided for the second budget cycle, only 3%. Generic pills may not arrive in low-income and middle-income countries until 2023. Less than 1% of the funding needed for diagnostics has been secured. Testing rates are roughly 100 times lower in low-income than in high-income countries. Testing rates have fallen in recent months. Norway and South Africa urgently call upon countries to provide their fair share to ACT A. The $700 million that Norway has allocated to ACT A for 2020 to 22 span across the 4 ACT A pillars. It includes funding for therapeutics and testing. My second point is this. Access to COVID-19 medicines must be viewed from a systems perspective. The obstacles that we face for COVID-19 were also seen 2 decades ago for the HIV/AIDS. Thus, we should have learned something. While COVID-19 has given rise to new collaborations, it is once again revealed barriers as well. Barriers to the sharing of knowledge, technology, production capacity, and delivery. My point is, in the long run, challenges related to access to medicines for diseases such as HIV/AIDS and COVID-19 cannot be solved through disease-specific solutions. It is a systems problem. We must share technology and know-how. We must increase local and generic production. In this respect, I'm pleased to see the license agreements through the medicines patent pool. We must invest in research mechanisms such as CEPI, and Norway will contribute more than $100 million to the coalition over the next 5 years. To conclude, we are now facing multiple global challenges beyond the pandemic, all at the same time. And in Europe, a war on our own continent demands attention. Still, let us keep COVID-19 high on the international agenda. The pandemic can only be overcome by close global collaboration. Thank you.
Thank you, Minister Tvinnereim. We're all indebted to Norway's global leadership throughout this pandemic. And thank you for highlighting the funding gaps that will need to be addressed if we're really to roll out not just the vaccines, but tests and treatments in the coming months. Our final speaker in today's session is Dr. Karen DeSalvo. Dr. DeSalvo is Google's Chief Health Officer. Google's commitment to $150 million in donated advertising to combat the myths and disinformation is greatly welcomed. And Dr. DeSalvo, you've observed the pandemic and the infodemic side by side, and I'm looking forward to your remarks to help us understand what can we do to make sure that people have accurate information and know what they need to do to access tests and effective treatments in the coming months. Dr. DeSalvo, you have the floor.
Thank you, Bill. Excellencies, distinguished fellow panelists, ladies and gentlemen, well, we're very pleased to be with you all today at this second White House COVID-19 summit. It's important we all continue our global focus on the pandemic. I also want to thank President Biden, the White House, and co-host nations for this session, Belize, Germany, Indonesia, and Senegal, for their leadership throughout the global pandemic response. At Google, we understand the importance of building more equitable healthcare and helping people build healthier lives. We've been proud to do our part during the pandemic. COVID-19 stepped onto the world stage less than 30 days after I joined Google, and at the time, most people had never heard of flattening the curve, social distancing, or mRNA vaccines. Our vaccine safe was one of the most frequently searched terms in 2020 and 2021. In these times of uncertainty, people turned to Google for help. In response, our whole company pulled together to provide answers when people needed them most. Throughout the pandemic, Google has worked regularly with public health authorities, including the United States CDC and the World Health Organization and others. Just one of the many ways that we did this was to amplify important messages from public health authorities by donating Google search advertising and offering expert assistance to ensure their messages are as effective as possible. Through this initiative, the WHO has served more than 2 billion COVID-related public service announcements, connecting nearly 100 million people to high-quality COVID-19 information. We know that these public service announcements are especially impactful at filling information gaps and combating misinformation. For example, in Bolivia, we saw a spike in searches surrounding chlorine dioxide as an alternative COVID-19 cure. We responded with PSAs that reaffirmed vaccines are the safest and most effective way to keep yourself and your community protected from COVID-19. Click-through rates on vaccine-related WHO ads in Bolivia were 60% higher than global averages, It's examples like these that underscore that the right information at the right time can save lives. Today, we're building on that work with a new commitment that Google will donate an additional $150 million in search advertising, bringing our total commitment to over $1 billion. This will support organizations such as the WHO, Gavi the Vaccine Alliance, and global government ministries, among others. At Google, we're grateful for the opportunity to apply our tools and expertise to support global efforts advancing equitable access to vaccination, diagnostics, treatments, and pandemic recovery. Thank you for the opportunity to join you here today and contribute to this critical effort to end the pandemic for everyone, everywhere.
Thank you, Dr. DeSalvo, and thank you for reminding us that accurate information is as critical a tool to address this pandemic as vaccines, tests, oxygen, and therapeutics. I'd like to close this session with one final thought. As we look to the future, the global community has recognized in this pandemic that investing in health systems, investing in pandemic response is not a luxury or a nice to have. It's not only important for patients to be able to respond and get the effective care they need, but as we've learned, the investment in health is critical to maintain our communities, our societies, and our economies. So I'm grateful for all the commitments we've heard about in this session and throughout the day to continue to make both vaccines and tests and treatments widely available on a global basis, and grateful for everyone's support and interventions today. I'd like to thank the White House. I'd like to thank our co-host for today's session from Belize and Germany, and I would like to thank our distinguished panelists for their remarks, and thank all of you for your attention.
Dear friends, thanks to President Biden for continued leadership in the global fight against COVID-19. The world has made significant progress against the pandemic in the last 2 years. Nevertheless, global access to vaccine is still unbalanced, and the world is still not fully prepared for the next pandemic. Denmark remains fully committed to the global efforts to end this pandemic as quickly as possible. We fully support the necessary goals of vaccinating 70% of the global population. At the same time, we recognize the immense challenge in getting vaccines to every person who wants to be vaccinated. That is why I'm happy to announce a new contribution from Denmark of more than $10 million to COVAX in support of vaccine rollout in developing countries. This brings our total contribution to COVAX to more than $28 million and our combined contributions to the ACT Accelerator to more than $64 million. Additionally, Denmark has donated more than 10 million vaccine doses. Denmark remains committed to end this pandemic, preparing the world for the next pandemic and protecting those who suffer the most. To do that, we need a strengthened WHO and a new binding agreement on pandemic prevention, preparedness, and response. And we need to establish a new global funding mechanism for our common health security, and a fifth, in close coordination with the WHO. We must leave no one behind. Thank you.
Senhoras e senhores, é com satisfação que represento o governo brasileiro nesta segunda cúpula global de Covid-19. No enfrentamento à pandemia, fortalecemos o nosso Sistema Único de Saúde, SUS, com mais de 20 bilhões de dólares em recursos extraordinários, além dos mais de 100 bilhões de dólares para o financiamento regular da saúde desde 2020. O Brasil realiza a maior campanha de vacinação de sua história, com mais de 490 milhões de doses de vacina distribuídas e mais de 77% da nossa população com o esquema vacinal primário completo. Além das ações em âmbito nacional, o Brasil vem contribuindo aos esforços globais para o alcance da meta de 70% da população de todos os países vacinada até a metade deste ano. Já realizamos doações que somam 5,6 milhões de doses e hoje reafirmamos o compromisso do Brasil em doar até 86,7 milhões de dólares à COVAX AMC. Como todos os desafios globais, a pandemia da Covid-19 não reconhece fronteiras e sua superação só se dará com base nos princípios da solidariedade e da cooperação internacional. O Brasil se compromete a continuar promovendo o acesso equitativo a vacinas, além de aumentar o acesso a diagnósticos e tratamento por meio de incentivos à produção local. Muito obrigado.
Through the COVID-19 response mechanism, or
Con el mecanismo
C19RM,
de
the
respuesta a la
Global Fund is delivering over
COVID-19, el
$4.4
Global
billion
Fund está
in
entregando
grant
más de
funding to enable low and middle income countries to gain rapid access to tests,
para
treatments, and
obtener
personal
acceso
protective equipment,
rápido y
PPE,
poner
while strengthening systems for health to respond to the pandemic. Getting more people to test for the virus has been fundamental to containing transmission, identifying the emergence of variants, and getting people on treatment. Investing in treatment approaches and systems such as medical oxygen has reduced COVID-19 deaths and will continue to save lives beyond the pandemic. With support from donors, led by the United States, we have been able to move swiftly to expand access to COVID-19 diagnostics and treatments. These efforts have saved many lives across the world. For the Global Fund's 7th replenishment, which will take place this year in the United States, hosted by President Biden, the United States has pledged $2 billion as the first tranche of an intended contribution of $6 billion over 3 years. We hope other donors will follow the US example, making strong commitments to support our collective efforts to get us back on track to end HIV, TB, and malaria as public health threats. With a replenishment target of at least $18 billion, the Global Fund aims to save 20 million lives over the next 3 years and invest at least $6 billion to reinforce systems for health and strengthen countries' abilities to prepare and respond to future pandemics by reinforcing their capacities to prevent, detect, and respond to multiple pathogens. Thank you.
Hello, my name is Yves Dubaquier, Perkin-Elmer's Senior Vice President for Diagnostics. Perkin-Elmer, a global leader in diagnostics dedicated to innovating for a healthier world, is committing to saving lives now by making COVID-19 tests available to all low and middle income countries for under $5 per test, based on volume commitment and supply chain feasibility into those countries. Perkin-Elmer knows that detecting COVID-19 and isolating people is still a challenge in many places, and believes this commitment will enable increased access to the necessary tests and diagnosis to address public health challenges. Perkin-Elmer is also working with multiple international organizations and non-governmental organizations, NGOs, to make rapid antigen tests more widely available and economically accessible to low and middle income countries, as the company did when it supplied more than 2 million tests to the government of India to help accelerate countrywide capabilities. To accomplish the shared goal of creating sustained access to testing globally and for high-risk populations in low and middle-income countries, Perkin-Elmer believes that public-private partnerships and government support enabling industry partnerships with NGOs, as well as eliminating regulatory barriers across countries, will be critical. PerkinElmer remains dedicated to continuing to develop accessible diagnostic solutions to address the global public health challenges created by the COVID-19 pandemic.
Okay, good morning, good afternoon, good evening, everyone. My name is Dilip Singh, and I'm the Deputy National Security Advisor for International Economics here at the White House. I also serve as President Biden's Sherpa for the G7 and G20, which represent the major democracies and leading economies of the world. Of course, in this latter regard, I was delighted to hear the remarks this morning from the chairs of the G7 and G20 this year, Chancellor Scholz and President Widodo, who co-hosted this important event, along with our hosts representing the African Union and the Caribbean community. Today is all about multilateralism in action, and multilateral action is precisely what we'll need to meet the great challenges of our time: climate, migration, health, all cross-border risks that we're facing across the world. And with regard to health, let's say it again, this pandemic is not over, and global leadership is what's needed to control COVID-19 and prepare for future crises that we know will come our way as biological risks continue to grow. So it's fitting, as we look into the future, that we end today's event on what we need to do now to prepare and prevent that for the next variant and biological crisis, while there's still time. In this session, I'd like to have a dialogue about how we can speed our preparations and raise our ambitions while memories are fresh and before we lose the will to act boldly. We heard this morning an additional pledge from President Biden and early pledges from Germany and the European Commission towards a new pandemic preparedness and health security fund housed at the World Bank. The mission for this panel is to figure out how we can now build a crescendo of support. So I'd like to welcome our co-host of this session, Honorable Minister of Health, Budi Sadikin of Indonesia, and our own Secretary of State, Antony Blinken. Minister Sadikin, thank you for Indonesia's long-standing leadership on this topic, as well as the recent consensus you've driven to establish a new pandemic preparedness fund at the World Bank this summer. The floor is now yours to provide opening remarks. Minister Sadikin.
Good morning, good afternoon, good evening, Excellencies, ladies and gentlemen. Only through great earthquakes lofty mountains rise. COVID-19 has separated us physically, and yet it has not stopped us from working together, building a world anew, a safer place to be. As health leader, it is our responsibility to ensure that the world learns the lesson of the COVID-19 pandemic has taught us. Ladies and gentlemen, COVID-19 pandemic has shaken our global health systems, bringing dire consequences to our lives and livelihoods, to our health and economy. And the time is high for us to build a better and more resilient global health systems. As Indonesia assumes the G20 presidency, we are committed to 3 health priorities. First, we are continuing Italian G20 presidency initiative to setting up Global Financial Intermediary Fund, followed by creating an easy and just access to emergency medical countermeasures that include vaccine, therapeutics, and diagnostic tools, and linking Global Genomic Surveillance Lab. Indonesia is very grateful to the commitment shown by the government of the United States, Germany, Republic of Korea, and the European Commission on our collective effort to establish the new financial intermediary fund. However, money alone will not be enough. We need to formalize a mechanism such as Act Accelerator to raise and mobilize emergency medical countermeasures in well-coordinated mechanism involving global institutions such as WHO, UNICEF, Gavi, and CEPI. Then, we must also link our global surveillance labs. This pandemic has shown that global access to early genomic data has allowed the rapid discovery of vaccine and saved millions of lives. Second, We need to harmonize global health protocol standards to revive the global mobility of people and goods, and to revive the global economy. Indonesia has started this mutual recognition initiative using WHO standard, modern and digital solutions at the regional level, and is looking forward to partnering with the EU and all G20 members. And third, we need to expand global manufacturing and research hubs, particularly for vaccines, therapeutics, diagnostic, and personal protective equipment, especially in the global South countries. Ladies and gentlemen, with great crisis comes great opportunity. As we recover from this difficult time, we now must invest in what really matters. Only then can we build a healthier and a safer world. It will be a legacy from us to our children and the children of our children that they will forever treasure. Thank you.
Thank you, Minister Sadikin, for those poignant comments, and once again for your leadership in the G20 on these issues. I'm now pleased to introduce U.S. Secretary of State Tony Blinken. Mr. Secretary, you've been a champion for health security and pandemic preparedness for years and have been working all around the world with foreign ministers to increase attention on pandemics as national security crises. How can we keep attention on this issue, and why is it so important now, more than ever, that we do so? Over to you, sir.
Dilip, thank you very, very much. And colleagues, it's wonderful to be with all of you and to see you on the screen. And Minister Sadikin, thank you. I very much share both the sentiment and substance of your remarks. We're grateful for them, grateful for Indonesia's leadership on the many challenges posed by COVID-19, especially during the presidency of the G20 that you hold. And to all of our friends from around the world, from the public and private sectors, from civil society, thank you for joining our second Global COVID Summit. Since we met last September, more than 5 billion vaccine doses have been administered around the world. That brings the global vaccination rate in total up to 60%. That progress proves our collective resolve. Still, we have more work to do and a ways to go to ensure that every country meets the 70% vaccination target that was set last year. That means a number of things. It means grappling with the inequities exposed by the COVID-19 pandemic. And today, countries and organizations have made new commitments to help get vaccines to vulnerable populations and expand access to testing as well as to treatment. Our pledges today now total more than $3 billion. That's an unmistakable signal of how countries and organizations spanning the globe continue to be deeply invested in this fight. Speaking for the United States, our work on COVID with partners around the world has expanded significantly in the past year. We launched the Global Action Plan with 19 partner governments to take on the biggest barriers that remain, like addressing vaccine confidence, solving the so-called last mile challenges in vaccine delivery, cold storage and transit. We're working with partners to shore up critical supply chains and protect healthcare workers. And these 19 countries have come together to each take responsibility for a different line of effort to meet the goals that we set, whether it's geographic or functional. But for purposes of this session and for the purposes that Minister Sadikin outlined so beautifully, we have to look ahead, not only to keep up the fight against COVID-19, but to prepare and prevent the next pandemic too. In particular, 3 areas where we agree, if we work together, we can actually emerge from this pandemic stronger for the future. First, we have to ensure sustained and consistent funding for global health to break the cycle of neglect, then panic, then neglect again that we often see when it comes to global health. A dedicated fund for pandemic preparedness and global health security housed at the World Bank with the support of the World Health Organization will help make that happen. Today, thanks to Italy and Indonesia's leadership in the G20, and with contributions from Germany, the European Commission, we are moving forward to make this fund a reality. The United States will support it, as you've heard, with an additional contribution of $200 million, building on the $250 million commitment that we made at last year's summit. Second, we need to strengthen our collective capacity to prevent, detect, and respond to health emergencies, not only on the global level, but on regional national, local levels as well. That means better disease surveillance and data sharing, building out our lab networks and health workforces, increasing research and development on effective vaccines, strengthening critical supply chains, expanding the global network of experts. All of this together will help us respond more quickly to crises in the future and save lives. Third and finally, we agree that we must modernize our global health architecture, the institutions, the rules, the norms that govern our cooperation, because this pandemic has shown us that we can and should do better. To that end, the United States strongly supports the efforts underway at the World Health Organization. We want to ensure that in the future, our collective response is swifter, better coordinated, more equitable, with more countries represented across decision-making as well as execution. COVID-19 has taught us that when it comes to global health, it's become a cliche, but it's powerfully true. None of us are safe until all of us are safe. And furthermore, that our health security is closely interlinked with our economic security and our national security. So we must not waste this very, very hard-won knowledge. Instead, we need to seize the opportunity to come through this pandemic better prepared to prevent and respond to future emergencies. I'm very much looking forward to hearing from each of you today and to working with you to translate this shared vision into action, into reality. Thank you. Dilip, back to you.
Thank you, Secretary Blinken and Minister Siddiqui, for underscoring the urgency of this moment and framing the opportunity to act now. So at this point, I'd like to introduce our panel of esteemed thought leaders, global experts, and champions on the front lines to make sure we're acting now to prepare for the future. So we're honored to welcome today President David Malpass of the World Bank Group, Her Excellency Dr. Ngozi, Director General, World Trade Organization, who also served as co-chair of last year's G20 high-level independent panel, Sir Jeremy Farrar, Director, Wellcome Trust, Mr. Mark Malloch Brown, President of Open Society Foundations, and Dr. Joy St. John, Director, Caribbean Public Health Agency, CARPHA. Thank you all for joining us today. I'd like to start with our first panelist, Mr. David Malpass, President of the World Bank Group. President Malpass, thank you. The World Bank has had a critical role in supporting pandemic preparedness for the future, especially with the focus on identifying sustainable and reliable sources of financing. So we welcome the opportunity to hear from you about the World Bank's own commitment and ongoing work to establish a new pandemic preparedness and global health security fund housed at the World Bank. We've heard leaders make concrete commitments today, both financial and political, to get this fund started and to ensure we get the governance and goals right. So let me ask, what does the World Bank need to see in the weeks ahead to get this fund launched? And what can the bank do to further catalyze this progress? President Malpass.
Thanks, Dilip, and it's good to see everyone today. The summit is timely. What I'd like to do, Dilip, is give you a update on our current programs and on the FIF itself. As you know, we're fighting the COVID crisis, which involves surge financing, and then also the longer-term financing needs for pandemic preparedness into the future. We have a $30 billion health portfolio in over 100 countries now, and as you know, and we're involved in, IDA 20 is going to include an ambitious commitment to pandemic preparedness and response. So that will be spending out over the next 3 years. And then also IFC is helping with its $4 billion global health platform. So as we look ahead, the FIF is vital in this. It will provide funding that complements the financing and the technical advice that we're doing and help strengthen the health systems and preparedness of the client countries. It's going to be important as part of the solution for capacity building, and I'm hoping it will and planning that it will bring additional dedicated resources that can help incentivize countries as they make their new investments in healthcare. I was happy for the support of the G20 during the process, and I particularly want to thank the the U.S. for its involvement, also working with interested governments and with the WHO and other partners. And today I was really very glad to hear the additional pledges from European Commission, from Germany, and from the U.S. For the contributions to the fifth. Those are going to be vital. So let me say one more thing, Dalip. I want to come back to COVID itself. You know, we're not done with it. It still is ever present. We are strongly committed to ending it. Our vaccine financing will have reached $11 billion by the end of June and covering 81 countries. So what we're working to do using the available supply of vaccines, which is now readily available, is to increase the number of vaccinations. We did a report on that for the G20. We worked in collaboration with the WHO, WTO, IMF, and the COVID-19 vaccine delivery partnership. And that identified country by country what the needs are and the solutions. And we also had a high-level meeting for that at the spring meetings. And then I can tell you that our multilateral leaders task force, which my partner Ngozi is here on the panel today. We just sent a joint letter to the African Union to offer our coordinated support for accelerating vaccination efforts there. That our goal is to encourage demand across Africa. So that sums it up. We have the surge financing, the longer term financing, the work on the fifth, which I hope we can complete by June, and then get it up and running here in calendar 22, and that will give us a good launch for pandemic preparedness. Thanks.
President Malpass, for that encouraging update, especially the mention of June for the launch date of the 5th. And rest assured, we all want to work closely with you, the World Bank, and the WHO teams to get this done. I want to recognize at this point how critical the Indonesian G20 presidency and last year's Italian G20 presidency have been to drive this transformative effort forward. As I mentioned earlier, we're delighted to see the early pledges made by Germany and the European Commission today towards the establishment of this new financial intermediary fund, and the strong political support we've heard from so many others. This is leadership, but it's only a start. And I mentioned Italy because Prime Minister Draghi was pivotal last year in calling for the establishment of the G20's high-level independent report. And this group, made up of many of the world's brightest economists and health experts, this is the group that made the recommendation for this new financial intermediary fund in their historic report. And I say this because our next panelist, Dr. Ngozi, Director General of the WTO, was one of the esteemed co-chairs of this panel. So Dr. Ngozi, I welcome your additional reflections on the progress made to stand up this new fund and to also reflect on the future of pandemic preparedness more broadly. Dr. Ngozi, the floor is yours.
Thank you so much, Dilip, for those kind words. And I'm delighted to be invited to participate in this second COVID-19 summit. Congratulations on doing this again. I'm particularly pleased, as you said, that one of the recommendations of the Italian G20 supported high-level independent panel on pandemic preparedness, which I co-chaired with Senior Minister Tharman of Singapore and Larry Summers, has been picked for implementation. In this regard, at the last Global COVID-19 Summit in September, we were pleased to hear Vice President Kamala Harris commit the U.S. to establish and provide seed funding for this fund and to incentivize pandemic preparedness investments, one of our main recommendations. We've also now heard Secretary Blinken reinforce this support today. And Dilip, thank you for your cheerleading on this particular fund. The proposal for a financial intermediary fund, as you said, is now being supported and taken forward by the G20 Indonesian presidency. And we are pleased with the recommendation to house it at the World Bank. It is really wonderful to hear the significant political and financial commitments to the fund. But today's commitments are good, but they're just a down payment on the $10 billion a year needed to seed this fund. So we hope to see more commitment, more of it coming. Now the task remains to operationalize the fifth. At this session co-hosted by the key driving forces, I want to emphasize that the fifth needs the broad support from many countries. It's in every nation's interest to strengthen funding for global public goods and global health security. The financing mechanism should allocate funds across country governments, regional bodies, multilateral entities, and other types of recipients to drive progress towards preparedness standards established by the WHO, incentivize greater on-budget domestic investments in preparedness, and provide subsidies for high externality investments. In operationalizing the fund, we must ensure developing country voices are heard. The Ports to Arms Conference in Abuja in February allowed African voices to be heard on pandemic preparedness. As immediate next steps, the World Bank and the WHO, in collaboration with the G20 and G7 and the countries assembled at this conference, should agree to trigger the administrative process for creating the fifth at the World Bank, delineate the role of the World Bank in managing the fifth, and mobilize country support and funding commitments, making sure they continue following today's pledges. Establishing the fifth for pandemic preparedness alongside complementary reforms of the global health architecture, including an incremental increase in WHO-assessed contributions, will be essential to immediate and long-term collective global health security. The G20 announced that the new fifth will be finalized by June. June is fast approaching, and we must maintain the momentum to drive this forward. Turning to other needs, we must continue the push for decentralization of manufacturing of vaccines and other medical countermeasures. And this is one of the important externalities that this fifth should be financing. The WTO has been working with vaccine manufacturers on this issue of decentralizing manufacturing and helping them to lift the constraints on their supply chain, such as export restrictions and prohibitions, whilst encouraging trade facilitating measures. We hope that the fifth will indeed support this issue of deconcentrating manufacturing to developing countries. I'm also happy to say that the WTO is working on the request of developing countries for a TRIPS waiver. We hope to have a workable compromise text, which is being debated right now, and we hope it will be ready in June. All of these will be elements that will be important in our pandemic preparedness, helping developing countries to be ready the next time to manufacture and to be able to provide medical countermeasures for their populations. Thank you.
Thank you, Dr. Ngozi, for calling the fifth what it is. It's a global public good that solves the problem of pandemic preparedness funding being too low, too fragmented, too unreliable for too many years. And your leadership has been tremendous throughout this pandemic. You've maintained, even as you've dealt with the pandemic in front of us, you've maintained focus on the future, which is hard to do, but you have done it. And so we want to thank you for all of your contributions. Thank you as well for highlighting how this fund must serve low-income countries as well as regions across the world. Okay, next, Sir Jeremy Farrar of Wellcome Trust has spent his career focusing on preparing the world for health threats and pandemics, and I'd like to turn to him next. The role of philanthropy has been vital in this pandemic, and it's clear we need to find even more effective ways to partner on financing preparedness and building country capacity for the next pandemic. Dr. Farrar, I'd like you to speak to us today about how Wellcome is evolving its approach to long-term pandemic preparedness and health security. You've made a significant commitment. The fund we've been speaking about is one piece of the puzzle. How should foundations engage in this type of multilateralism? And how does new financing architecture also reinforce broader work on disease detection, R&D, and country capacity? Sir Farrar.
Philippe, thanks very much. It's a great pleasure and honor to join the second COVID summit. And thanks to President Biden and the whole White House team, governments of Indonesia, Germany, Senegal, and Belize. It's always also a great pleasure to follow Ngozi in everything I do. There's been many phrases often repeated over the last couple of years. We're all in this together and no one is safe until everyone is safe. These, of course, remain true, but let's be honest, we've failed to live up to those warm words, and there remains deep inequities in access to the critical tools. And we will not end the acute phase of this pandemic until all of those are resolved. We're not yet in control of this pandemic. And as we've seen in every country, although yes, this is a health issue, it's also a whole of society issue. It's a health issue, it's an education, it's an economic, it's a jobs, it's a trade, it's a debt, and yes, it's a political issue. And at such a time in history, I think philanthropy can and must play its part, along with civic society organizations, with industry, and yes, with governments. We cannot do what governments should and must do. Philanthropy should not replace governments or absolve them of their responsibilities, but we can complement, we can do things differently. We can take risks, we can be constructively catalytic and disruptive, and we are committed to working in partnerships. Welcome very strongly supports the mobilization of additional funds and providing today £10 million in seed funding towards the establishment of the Financial Intermediary Fund at the World Bank, as proposed by the high-level panel report to the G20 presidencies of Italy and Indonesia. I think this signals our early philanthropic commitment to working in partnership with others to establish this fund, and we hope help define its purpose, its governance, and its impact. And we call on others in philanthropy, in industry, civic society, as well as governments to join us and do so now at this critical juncture. Also, welcome as a founding partner of the CEPI Alliance. We've now committed an additional $150 million, which brings us to over $300 million in funding of CEPI since its initiation. And we continue to support the WHO Blueprint, which has done so much to galvanize and steer the global research and industrial communities. Welcome is also committed now to £16 billion over the course of the next decade to science to improve health globally. And infectious diseases is certainly one of the 4 central pillars of that strategy at Welcome, along with discovery science and the impact of climate on health and mental health. The 3 key areas that we think are critical to pick up: first, training and careers for locally embedded and globally networked public health professionals and scientists with the diverse skills needed in the 21st century. Secondly, surveillance is critical, but surveillance must lead to immediate action and equitable benefit sharing. And surveillance must be functional all the time and provide utility to communities, be trusted by communities, and there to address day-to-day local endemic and epidemic needs, including, for instance, in things like drug-resistant infections, and be able to identify, pivot, and prevent, and then respond immediately if and when inevitable emerging threats are identified. And critically, sustained funding for basic science and for partnerships in distributed research, development, manufacturing, and to ensure equitable access to drugs, to tests, and to vaccines for now and for the future, including the commitment to the 100-day mission. To conclude, this summit comes at an absolutely critical moment in this pandemic, but also in the 21st century. If we are to honor the commitments today, we can bring equitable health security for all, whilst remaining committed to long-standing endemic health issues of importance to communities. But we must use the political moment of this summit and turn it into real action to end this pandemic and make sure such a pandemic never happens again. That is within our grasp. If we make the right decisions, if we honor the commitments, then we can achieve that. Dilip, thanks very much for the invitation, and back to you.
Thank you, Jeremy, for your inspiring words and for bringing the foundation to the forefront of global needs and public goods. If I may abuse the privilege of the moderator's chair, I would say other philanthropic donors might take a page out of Welcome's book, and I hope you can inspire a race to the top. So as I'm reflecting on what we've heard so far today, including from our panelists, it's clear there isn't a solid line between the current COVID-19 response and preparing for the future. The two are obviously intertwined and increasingly so. The systems we need to make COVID manageable for all countries are the same systems we need to prepare for the next threat. Lord Malik Brown, how is Open Society Foundation helping to accelerate the COVID-19 response and thinking about this continuum into the future?
Well, Dilip, thank you. And it's great to speak after Jeremy and Ngozi and so many friends. And first, of course, a great gratitude to President Biden and the other leaders who've co-convened this meeting, and to all the panelists who've shown throughout the day such extraordinary commitment. But I do think, and it's what preoccupies us at OSF, that welcome leadership that we've seen can't disguise the fact that the world as a whole failed in its early COVID response. We failed both at the issue of global equity, but also of solidarity. And that betrayal is going to be with us for years to come, reflected in the public health outcomes, but more broadly in our politics and international cooperation. And as a foundation, I think we look at this through two lenses. One, if you like, as a moral voice, a voice of conscience, and then secondly, as to what can we do as a fast responder, if you like, in terms of innovation around an issue like this. But first, just a word to that moral point. We gathered in an alliance, a lot of our fellow foundations, to try and point out both the glaring inequities of the public health response, which continue, but also the risk of a widening economic crisis, one now compounded, of course, by the tragic Russian invasion of Ukraine, but which already in escalating food and energy prices and the inflation that has led to in supply chain disruption and now contraction for national security reasons, and with soaring debt bills across so many parts of the developing world, it threatens to engulf large portions of humanity in an extraordinary economic crisis that can only compound that public health one. And bringing that voice to bear is something I think all of us, Jeremy, but all other foundations do. We could try to make a strong point through our grantees as well as ourselves. But then to answer your question, Dilip, about looking forward, what can we do? And I want to just touch on three things we have done, which we think offer ways forward, if you like. The first is that we have tried to find financial engineering means to increase the efficiency of COVAX, to show how, in our case, the provision of 100 million guarantee to accelerate vaccine purchase, along with a fellow MedAccess's 100 million between us, has allowed COVAX to buy another 190 million doses this year, which otherwise the lockup of several hundred millions of donor funds would not have allowed them to do. And that's, if you like, a creative use of our balance sheet. Second, we have bought through our impact investment arm, Malogic, a testing company, and we've combined with Gates and other foundations in that acquisition. And we've moved it from Surrey, England, to the Pasteur Institute in Dakar, Senegal, of which you heard President Sakyal talk about earlier. And that investment, we hope, will allow the provision of low-cost tests across the continent for COVID and for other communicable diseases. But third, I just want to announce, looking forward, a new initiative which very much pairs with that Samantha Power made earlier on behalf of USAID. We're announcing a new test and treat program for low-income countries intended to prove the concept that, in fact, these are countries where test and treat is highly practical, as the history of HIV treatments have shown, and that in addition to the public health impact, that this will allow, a new ally, if you like, for long-term vaccination in containing this pandemic. And in doing this, we're working with both the Clinton Health Access Initiative and COVID Gap, a partnership of the COVID Collaborative and Duke University, to ensure that these pilots really go beyond just the 4 countries that we will initially fund to really scale up, along with USAID's program, to something that the World Bank and others can take on with much larger amounts of donor and multilateral finance, to make sure we have the protection not just of a vaccination strategy, lagging though it is, but a test and treat strategy, which will really partner it and strengthen the robustness of our public health response. Now, foundations, I say, can be pilots, they can be conscience, they can move quickly. But like everybody else at this summit, we cannot do it alone. We are dwarfed by the financial resources of many others who have spoken. But they, like us, need us all to come together, because it is only through global solidarity that we can hope to overcome and contain this threat. And so we look forward to signing the chairman's statement along with others as an expression of our partnership with all of you.
Thank you, Lord Malloch-Brown, for those creative examples of how acting now and preparing for the future need not be in conflict. Dr. St. John, we've saved the best for last and purposely given you the last word as someone who's managed a global response and built country capacity across a region with very disparate needs. So how is CARFA thinking about the future following this pandemic? What do we need in place now? And how can we adopt lessons from a diverse region like the Caribbean community? Dr. St. John.
Thank you very much for this opportunity, and CARFA is optimistic. Even though we are minded that the public health threats are always present, but we know we can employ health security measures to mitigate against and even prevent some of the future health crises, even if they aren't as big as pandemics, essentially because we are so travel and tourism dependent in CARICOM. The critical importance of infection prevention and control and biosafety and biosecurity were quickly highlighted in the early stages. And these are clear needs for operational improvement and capacity building. But there's also the sociocultural, mental health, and economic fallout of this pandemic that we have to ensure does not happen in the intense proportion that it did before. And all of this is pointing towards management of health crises with a multi-sectoral and all of society approach. So in the same way there's a structure of funding, I am glad that in the Caribbean, there is the Caribbean Cooperation and Health fourth iteration, which is a ready vehicle for receiving funding and technical support and capacity building to ensure that CARICOM countries are quick to detect the next pandemic, even as they are more prepared in all sectors, not just the health sector. There are targets and indicators to measure the degree of improvement of individual countries and the region as a collective. So what do we need in place now? We need effective science-based surveillance and alert systems that inform regional organizations as well as the UN system. We need access, and we've heard it voiced before, affordable, safe vaccines, treatments and technologies for testing and diagnosis, and the capacity to produce where the supply chain issues cannot be overcome. And we need adequate numbers of health sector workers, not just doctors and nurses. We need epidemiologists, administrators, planners, and health economists. And we need something as simple as bandwidth, cybersecurity, risk communication toolkits, training and funding for campaigns to counteract the infodemic of mis and disinformation. So the strategic funding can be plugged into the clear gaps that COVID-19 revealed to maximize impact. So a diverse region like the Caribbean community use the principles of working together makes you stronger. You need to understand how small under-resourced systems survive COVID-19. Our context was that we had to respect the power of prevention because we could not treat our way out of COVID-19. Political collaboration of heads of government worked well for regional decision-making. It also achieved the whole of society response with health in all policies and sectors. So the political dictates were interpreted at the health operational level by the chief medical officers in the health sector, who also worked together. So surveillance and alerts have to be combined with timely public health emergency management. And in Little CARICOM, we proved that it worked, but it had to be done alongside focused political leadership. There were other mechanisms that could work, say for CIS regions. They can benefit from CARICOM initiatives, which work well on a smaller population, like the tourism and health program that we use to make sure that we return to tourism safely. Larger, more complex health systems can use their greater resources to reach a more effective level of behavior change and risk communication than we were able to do in CARICOM to support vaccine uptake and adherence to national protocols. And the effectiveness of regional organizations like CARPHA and Africa CDC can be harnessed to implement pilots of new global initiatives for surveillance and alerts in countries of different sizes and complexities of health systems. So I just want to say one last thing. I would like to communicate to world leaders why it's important now at this moment to act and not just let this slide into the land of good thoughts and wishes. We don't need to waste this crisis. It's a good crisis, especially because we have the ability, the speed of science to support our learning from real-time experiences. It's not over, and the virus is contemptuous of political decrees that it is over, so it may yet mutate to something that moves even faster and hurts with greater virulence. So fund what is unfunded so that it works effectively. Climate change has sped up the cycle of infectious disease outbreaks, so the next outbreak is inevitable and coming sooner than expected. And the next virus may kill even more people and cause even greater economic disruption. So act now to mitigate or avoid that. The world struggled with supply chain issues even before the pandemic, and these have worsened. So let us act while we can still get essential commodities over a greater proportion of this world. And the world is getting more expensive. So delayed action may make future emergency response even more expensive than the 10 billion that it needs annually. Thank you.
Well, thank you, Dr. St. John, and to all of the panelists for laying out the scope of the challenge and also making clear our capacity to meet the moment if we act now. We just have a couple of minutes left, and I actually want to pick up where Dr. St. John just left off with a lightning round for each of our panelists. So for very short responses, less than a minute, let me ask the same question that Dr. St. John just answered, which is that as we think about preparing for future infectious disease threats, including improving the financing architecture, how would you communicate to world leaders directly why it's important right now at this moment to act? And I'll go in reverse order this time. And Dr. St. John, you just kicked us off, so I'll go straight to Lord Malik Brown.
Well, let me quickly say, never waste a good crisis, I suppose, as you know, as is often observed. And now is the moment to understand, while the lesson is still so fresh in our minds. And in fact, while as so many speakers have said, the crisis still is very much with us, that now is the moment for effective multilateral action. And I think the challenge to leaders is the time that multilateralism on the political front and on the financial front is under more stress and strain than it's ever been. Can we use this shared public health crisis to start to rebuild collaboration and trust in the world, to recognize this is a common threat that needs a common response and common shared statesmanship?
Sir Jeremy Farrar, you're next.
I think it's critical to realize COVID is bad, but it's just a symptom of underlying drivers that are going to be with us through the 21st century. Climate change, urbanization, inequality, changes of human-animal interfaces. These are the key drivers, and we've witnessed that over the last 20 years. Series of epidemics, regionally, nationally, some pandemics. We've not taken them seriously, and we've paid the price. You can either invest now and save lives, save jobs, save increasing debt levels, or you'll pay later. And the sums, I'm not an economist, but the sums massively outweigh by investing earlier in the things that have come up in this session and others during this summit. So the urgency of the moment is now, and let's not waste this one as we've wasted the previous warnings over the last 20 years.
Thank you, Sir Jeremy Farrar. We do have two economists next. So first, Dr. Ngozi.
Thank you very much, Dilip, and very interesting debate. I would say to policymakers, look, this is good for your domestic politics. Because no one can solve this problem alone, it's good for you to invest now, as others have said. It belies common sense that we can spend $14 trillion fighting this pandemic and not be able to come up with $10 billion. Just compare those sums. There's no way even to quantify how much will be saved if you act now. That's what I'd say to policymakers. The next pandemic is round the corner, and this one isn't even over. So act.
Thank you, Dr. Ngozi. President Malpass, you get the last word.
Okay. Very good, Dilip, and good to hear everyone. And thank you for the additional commitment from Wellcome Trust. By our count, it brings us to $960 million for the fifth. So I'm hopeful that that will be enough to give us critical mass, and we can work with the G20 and get the steps done here to take the fifth to our board in June. One other comment, Dilip, is the need for the long-term focus of health preparedness. It needs steady financing and also steady programs in countries. So while we're doing the surge now for COVID and for vaccines, as we think about the next wave of this, we need to be thinking about a 20-year effort that launches right away, but then builds programs that will last until the next crisis. We don't want this to just be one moment. So thanks.
Well said. This is an investment, not an expenditure. And thank you, everyone, for this insightful discussion. I'm just reflecting on all of your remarks. Frankly, I found them inspiring. At the end of the day, the actions you're pushing the world to take will save millions of lives. And we can say unambiguously this is the right thing to do. I think we can also say it's the smart thing to do. I read the recent World Bank and WHO analysis. I would point everyone to study page 18. The analysis that's described there shows that for every dollar invested in preparedness, just taking the US as an example, countries can expect a return on investment of over $1,100. 1,100 to 1. That's several orders of magnitude greater than any traditional health intervention. So that's the opportunity in front of us. And I think the remarks you just heard are encouragement that our leaders, all of you, can help us meet this moment. So thank you again to Minister Booty, Secretary Blinken, to all of our esteemed panelists. We'll now hear from the final speakers in today's summit. Thank you very much.
My name is Nahashan Aloka from Pandemic Action Network. We are a partnership of more than 250 organizations around the world driving action to bring an end to the COVID-19 crisis and stop the next pandemic. This pandemic is not over, and the world is not prepared for the next surge of COVID or for the next pandemic. But we know what to do. We urge every world leader to double down and treat pandemics as a systemic threat to humanity. For our part, Pandemic Action Network commits to mobilize at least 100 new partners this year to advance the summit goals, with an emphasis on organizations in low and middle-income countries. We commit to being relentless in pressing governments, multilateral agencies, philanthropic and private sector partners to galvanize the necessary investments, coordination, and incentives to protect the most at-risk populations and meet COVID vaccination targets around the world. We commit to supporting efforts to drive forward a dynamic global test-to-treat strategy that prioritizes global access and addresses blatant inequity by increasing transparency on pricing and supplies. We commit to mobilize significant new, additional financial and political commitments to launch a dedicated new global fund for pandemic preparedness this year as a down payment on a better prepared world. We are at a now or never moment. Our global community of partners commits to spending at least $175 million by the end of this year toward these efforts. Pandemic Action Network will stay in this fight. We challenge every government, every organization to join us, step up and deliver with the actions, the resources, and the urgency that this crisis and our collective security demands.
Good morning, good afternoon, and good evening. My name is Ashish Jha, and I am the White House COVID-19 Response Coordinator, leading our nation's effort to bring this pandemic under control. I am honored to bring the second Global COVID-19 Summit to a close. More than 2 years into this global pandemic, we are, once again, at an inflection point. We have lost nearly 15 million fellow citizens around the world, 6 million officially recorded deaths, and another 9 million in deaths not captured by our surveillance system. More than 10 million children have lost a primary caregiver. The toll of this pandemic has been staggering. So what happens next? Well, that is up to us. Through human ingenuity and partnerships between the government and private sector, we have developed life-saving vaccines. We have developed treatments that alter the course of this disease. We have learned how the virus spreads and how it can be contained. We can now take control of this pandemic and bring it to an end. But it will take the work from all of us. And that's what brought us together here today. And that is what we heard today. We heard the urgency and the commitments from so many of you. And I want to thank all of you for your leadership, for your willingness to step up and solve the difficult problems that still remain. The proposals and the commitments we heard today are so important. Next, we will need to turn those commitments into action. From the start of this administration in January 2021, the U.S. has demonstrated its commitment to lead the battle against this global pandemic, with the clear understanding that the pandemic will not be over anywhere until it is over everywhere. Beginning with $2 billion in funding to COVAX, and then with our groundbreaking work on vaccine donations, we have made commitments, and then we've followed those commitments with actions. To date, we have delivered more than 530 million doses to 115 countries around the world. And critically, we've done this free of charge with no strings attached. And we didn't stop there. The President of the United States, his American Rescue Plan, helped transport vaccines across the world. It helps support public education campaigns to build vaccine confidence. And ultimately, it focused on ensuring that vaccines got into people's arms. And we never made these efforts alone. We never tried to go it alone. Indeed, we came to this fight with our partners. We worked with so many of you, including our partners at COVAX, to close that vaccine supply gap. We knew the donations were not enough, so we committed to building a resilient global manufacturing base. We have made real progress in this pandemic. But as you heard over and over again, we are not done. We still have important work to do. The most urgent is to turn all those vaccines into vaccinations. Because the truth is that we have many tools to combat this pandemic, but there is no more important life-saving tool than vaccinations. It is also the most effective way to prevent emerging variants. And that means vaccinating and boosting our most vulnerable populations, but it also means vaccinating the broader population, including our children, who benefit enormously from these life-saving vaccines. We need to ensure that children in poor countries enjoy the same protections that those in wealthy countries do. This is why the US, with COVAX, is leading the way, donating tens of millions of pediatric vaccines to nations around the globe who are ready to protect their children. But all of this work that we have done, the millions and millions of vaccines we have obtained, all of it is at risk without further funding from Congress, funding we requested months ago. We need to find ways to get shots into arms, both to save lives and prevent the emergence and spread of variants. Countries around the world have populations that need these life-saving vaccines. And the good news is we have the vaccine supply. But many of these nations need assistance getting people vaccinated. Getting people vaccinated is no small feat. Running national vaccination campaigns is hard work, and it requires resources. This is why the administration has been so clear with our Congress on their need to act, to prevent more loss of life, to prevent the emergence and spread of more variants, both at home and abroad. Beyond these life-saving vaccines, we need resources to ensure more people around the world get access to life-saving treatments. We are launching a series of programs on Test to Treat and working to ensure greater access to treatments around the world. So in closing, I want to stress the importance of learning the lessons of COVID-19 for both current and future pandemics. The bottom line is that global pandemics require collective action. They require a resilient global community that can think beyond its own narrow interests to see the benefits of global cooperation. That's how we prevent and detect and respond effectively to infectious disease outbreaks. The battle against emerging variants offers a training ground for that critical work. Yes, of course we need to think about future pandemics, but we must train ourselves by effectively combating the one we're already in, because this pandemic is not over. Science has delivered to us a whole set of tools. We must wield those tools to put this pandemic behind us. Too many of our fellow citizens have gotten sick and have lost their lives in the past 2 years. Just today, as you heard, President Biden marked the loss of 1 million American lives to this virus. This is a tragic milestone for our country. But the best way to honor all of those that we have lost in the US and around the world is to commit to working together to bring the suffering to an end. The Biden administration is committed to continuing to lead that effort and to being strong partners. Thank you to all of you for your leadership and your partnership in this fight. Stay safe and be well. Thank you.
It's Rafiat Akinyokun, a nurse from Nigeria. I grew up in an underserved community in the southwestern part of the country, where I witnessed the death of my friend to tetanus at the age of 6. This influenced my decision to become a nurse, to prevent people from dying from vaccine-preventable diseases, and the COVID-19 further heightens this passion. So I became an immunization advocacy champion with the Nursing Now Challenge at the Sabin Vaccine Institute, where I was trained on storytelling for advocacy and also improving my communication skills. With the knowledge that nurses are trusted professionals in the community, I used my skills to influence hundreds of community members to take the COVID-19 vaccine by using simple, clear, indigenous languages for health education on vaccination and also ensuring vaccine safety. This shows the impact that nurses could have when they are invested in, empowered, and supported. If we want to vaccinate the world, then healthcare workers, particularly nurses, should be funded. I'm pleased to know that the United States is proposing a new global health workers initiative, and this should be funded. Currently, nurses are receiving a lot of applause from various international organizations as they celebrate their Nurses Week, but we cannot vaccinate the world on applause. We need to be connected to, we need to be listened to, we need to be paid, and we need to be included in policy discussions. An investment in nurses is an investment that can never go wrong.